Ayubowan, a very good afternoon to all of you. Welcome to Rasa Sambhasha with the Rasashastra Sambhasha 2025, the 8th edition of it. We're going to commence our day's proceedings in a short moment. We request all the invitees, the participants, to take your seats as we are going to start the event in another 5 minutes' time. Please make sure to walk into the hall and take your seats as we are to commence the 8th edition of Rasashastra Sambhasha 2025 in a short moment. Thank you. Rasashastra Sambhasha සමග එක්වන ඔබට කරන කාරුණික නිවේදනයයි තවත් මිනිත්තු කිහිපයකින් අපි අද මෙම වැඩසටහන ආරම්භ කිරීමට කටයුතු සූදානම්. ඔබ සැමට ශාලාවේ අසුන් ගන්නා ලෙස අපි තාම ගෞරවයෙන් ඉල්ලා සිටිනවා. තවත් සුළු මොහොතකින් අපි රසශාස්ත්‍ර සම්භාෂා 2025 ආරම්භ කරන්නට සූදානම්. කරුණාකර ඔබට හිමි අසුන් ගන්නා ලෙස නැවතත් ඔබෙන් ඉල්ලා සිටිනවා. ස්තුතියි. Ladies and gentlemen, once again a warm welcome to Rasashastra Sambhasha, the 8th edition of it, brought to you by Sri Dutapapashwa Limited. As we are about to commence the event, we request all of you to take your seats in the hall as we're going to bring you the Rasashastra Sambhasha with the history of 153 years as Sri Dutapapashwa Limited has been providing the health and happiness the humankind requires as they provide the distilled wisdom, experience and expertise in ancient Ayurveda throughout the years, up to 153 years since 1872. As we are to commence the proceedings, we shall now request all of you to stand in attention for the national anthems of Sri Lanka, followed by the national anthem of India.
Sri गण मन अधिनायक जय हे भारत भाग्य विधाता। पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा। विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा। तव शुभ नामे जागे तव शुभ आशीष मांगे। गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता। जय हे जय हे जय हे जय 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 हे।
Let us now have the lighting of the traditional oil lamp. I may invite following dignitaries to light the lamp. Our chair today, Professor R.S. Jayawardena. Our co-chairs, Professors P. Molligoda and Dr. H.K. B.M.S. Karunaratne. Dr. Pratnya Aptikar, Dr. Saroja Veerkon, Dr. Mukesh Chowda, Dr. Anura Vikramanayaka, and Mr. Ranjit Puranik, the Chairman and Managing Director of Sri Dutta-Papeshwar Limited, Mr. P. Vasudevan, Chairman of AVH Distributors Private Limited, Professor Priyani Piris, Dean of Gampa Vikramaraj University of Indigenous Medicine. We also remember Professor Kamal Pereira, Dean, Faculty of Indigenous Medicine, University of Colombo. Thanking all for joining the lighting of the traditional oil lamp, let us rise from our seats for the Dhanvantari Puja, and I invite Professor Jayawardena to garland the Dhanvantari statue.
Yogeeshwaraya Namaha.
Please take your seats. And thank you for joining the lighting of the oil lamp. With great pride and honor, Sri Dutta-Papeshwar Limited is presenting the 8th edition of Rasashastra Sambhasha 2025, a distinguished forum dedicated to the exchange of knowledge and experience in the specialized science of Rasashastra. Once again, welcome you all to the BMICH as we're going to have an eve filled with expertise who are going to share their knowledge all the way from India and from Sri Lanka as well. ඔබ සැමව ඉතාම ආදරයෙන් ගෞරවයෙන් නැවතත් පිළිගනු ලබනවා රසශාස්ත්‍ර සම්භාෂා 2025 මෙවර පැවැත්වෙන මේ වැඩසටහන වෙනුවෙන් එකතු වෙන අපේ වෛද්‍යවරුන් ඒ වගේම ශිෂ්‍ය ශිෂ්‍යාවන් ඇතුළු ඔබ සියලු දෙනාව. And also I would like to remind that you'll be able to watch us live from the STL website as well as the Facebook page from now on. ඔබට සජීවීව නරඹන්නටත් අවස්ථාව ලැබෙනවා Facebook පිටුවෙන් සහ වෙබ් අඩවියෙන්. And now, to officially welcome the gathering, I would like to call upon Before the welcome address, I would like to call upon the chairman and the co-chairs to the head table, Professor R.S. Jayawardena. Chair of the forum today, Professor R.S. Jayawardena, who's a distinguished authority in Ayurveda and Yoga with over 30 years of expertise. A senior professor at the University of Colombo and a visiting faculty at the Postgraduate Institute, Professor Jayawardena has held key leadership roles, including the director of the Institute of Indigenous Medicine and registrar of the Sri Lanka Ayurved Medical Council, shaping policy and advancing Ayurvedic education and practice. Welcome you, sir, and thanks for being with us today. And now I would like to invite the two co-chairs of today's session, Professor Dr. S.P. Molligoda, Head of the Department of Basic Principles, Ayurveda Anatomy and Physiology at Faculty of Indigenous Medicine, University of Colombo, and Dr. H.K. B.M.S. Karunaratne, Senior Lecturer and Head of the Department of Chikitsa at the Faculty of Indigenous Medicine at the GWIM. And I would like to invite Dr. Mukesh Chowda to join the head table. To officially welcome the address, welcome all of you and deliver the welcome address, I would like to invite Mr. Ranjit Puranik, Chairman and Managing Director of Sri Dutta-Papeshwar Limited. Please put your hands together and welcome Mr. Ranjit Puranik.
Friends, it's been a very long time since I've come for the Rasashastra Sambhasha, and I can say very clearly that this forum is growing. It's growing with the times. I'm seeing tremendous amount of support coming in not only from the academics, but at the outset itself, I would like to thank our collaborators for all our entire Rasashastra Sambhashan series, and that's both the Faculty of Indigenous Medicine in University of Colombo as well as in Gampha. Your collaboration, your entire partnership, your encouragement has propelled Team SDL in Sri Lanka to move from strength to strength. Also welcoming today the continuous support that we have received from not only officials, very senior officials from Ministry of Indigenous Medicine, Government of Sri Lanka, also welcoming the provincial commissioners, very senior faculty from University of Colombo and other parts of Sri Lanka, senior practitioners that have come, and of course scholars, researchers, as well as students who take a very keen interest in progressing their entire lives in the service of Ayurveda and, of course, society. So today is a very momentous day, not because it's the 8th Rasashastra event in this entire series, but we have a stellar lineup of very, very accomplished speakers who are coming to address us. And I'm sure they would be introduced before they speak, but under the chairmanship of Dr. Jayavardhane and both the co-chairs who have been able to guide previous Rasashastra Sambhashans also, I think we are in for a very rich afternoon of sharing of experiences. Generally and always, we are always asked whether a question-answer session, an interactive session can follow, but somehow, the format of this session does not permit that. But to me, this is a matter by which the insights, the absolute distilled experiences of all our speakers come forth. And I would like to in advance thank all the speakers traveling all the way from India. Is my colleague, Dr. Mukesh Chawda, of course. He heads our entire research domain. And I cannot begin to imagine the gratitude that I wish to express for both the speakers who have traveled from India. Dr. Sujata Kadam, she's been a senior, a kind of inspiration for a setup of the kind of campuses for Ayurvedic hospitals. She's a director of All India Ayurvedic Institute in Goa. She brings with her a very rich experience, and she also has set up and actually run the All India Ayurvedic Institute in Sarita Vihar in New Delhi. Both of these campuses are iconic in the sense they mark a very new beginning in the last mile public health programs that the government can have, coupled with great amount of research. So I do thank and welcome Dr. Sujata Kadam today here. She's going to address us. And another accomplished practitioner from Mumbai. She's also an educator, another inspirator. She inspires scores and dozens of students at one time, continuously traveling for CMEs, continuously traveling for taking webinars. Dr. Pradnya Aptikar, she practices in Thane, which is a city, sister city of Mumbai is what we can say. But in spite of, how should I say, discouraging and to the disappointment of many of her patients, she has chosen to take 3 days and come to Colombo and address us again. She will talk about various aspects about her experiences in using Rasashastra products in her entire practice and the kind of care, the kind of very thorough documentation, even for a private practitioner, that she takes. I'm sure she will say much more on that. And of course, we are blessed with Dr. Saroja Virakon, who would also be addressing us. Madam, welcome here. And we are also talking about Dr. Vikrama Naike, who is also a practicing surgeon in Shalya Tantra. He has also taken the time off to come and address us, and I'm sure we are going to listen to the expert comments from not only him, but also both our co-chairs, Dr. Karuna Ratne, as well as Dr. Moligada. And to me, this is going to be an afternoon where, when we talk in terms of Rasashastra, we're not going to be referring to this entire Shastra as being heavy metals and all of these kind of stigmas that are attached, but are really going to get distilled experience from everyone. Rasashastra Sambhashan is a platform that, sure, our company kind of initiated and has taken forward. It's also meant to be a dialogue between scholars in India as well as Sri Lanka. We are all aware of the kind of competition of Guti-Vati that my company also has been running, and I do thank the faculty, the University of Colombo as well as Gampa, for ensuring that their students have always participated in Jyotismati. And this is the kind of relationship which should not know political borders, should not know anything but actual in the service of Ayurved. It's an attempt by our company, by everybody in my team, to see that something like this is realized. You'll also be happy to know that similar seminars is something that my team also conducts in Nepal from time to time. And this is spreading the light of Ayurveda in whichever way we, as the fortunate ones, have been able to inherit this science from our forefathers. Ultimately, it's something that my company has imagined after 153 years as to what is our mission. What exactly does 153 years stand for? And the summary was very clear when we sat down, that ultimately the entire organization is striving and doing anything it can to spread good cheer, to spread health, to spread happiness with the entire channel and medium of Ayurved, and we will do that forever. So yes, it was a great start. Both the national anthems as well as the Dhanvantri Stavan have a very special effect on all of us. It kind of brings down our entire attention to very much this room. And on behalf of everybody in Sri Dutpapeshwar, those watching online, as well as my entire team that is present here in Sri Lanka, we welcome all of you and look forward to a great afternoon of wisdom. And thank you all for coming.
Thank you, Mr. Ranjit Puranik, for your word of inspiration. It's an honor to have you here today with the 8th edition of Rasashastra Sambhasha 2025. And I would like to invite our first speaker of today's event, Professor Dr. Sujata Kadam, Dean at All India Institute of Ayurveda, Goa, and Head of Department of Stri Roga Prasuti Tantra, again at AIIA, New Delhi and Goa, who is a leading academician and expert in Ayurvedic gynecology with over 29 years of experience. She has guided over 60 MD and PhD scholars and contributed extensively to research, curriculum development, and public health projects. A prolific speaker at global forums including SCO and G20, Professor Kadam has 55 plus publications to her credit, and she'll present an expert discourse on vital role of Rasaushadhi in Prasuti Tantra. Over to you, ma'am.
Respected chairperson, co-chair of this session, Dr. Chawda sir, Dr. Ranjit Puranik sir, Dr. Ketan, whole entire team of Dutpapeshwar, and dear Ayurveda lovers gathered in this hall. Good afternoon to everyone. Namaste to all. And I am here to share my experience of using Rasaushadhi in my obstetric practice since 29 years. And the presentation will be there on few drugs, emphasizing activity of few drugs, and of course, how I'm using those drugs, and the common problems in pregnancy, how we are dealing, or which kind of Rasaushadhis we can use in day-to-day practice to overcome the pregnancy problems. As I'm talking about the vital role of Rasaushadhi, it will be starting from the preconceptional thing also, because Ayurveda is not recommending the routine medicinal supplements in antenatal care. But nowadays, with changing lifestyle, with the quality of food, whichever we are taking, and many other things, day-to-day problems in gynecology or obstetrics, they are very much increasing. Every fourth patient we are getting of PCOS in our clinics. And that will be leading to infertility. Again, if that patient conceives, that is leading to many pregnancy complications, like GDM, gestational diabetes, like hypertension, repeated abortions, and many other. So to deal with these problems, I'm using many a times Rasaushadhi. Always there will be a question in your mind whether we can use this Rasaushadhi in pregnancy-like condition, whether to use, whether they are recommended, and how to use them, or in which quantity, for which duration we can use them without a fear. Because everyone is nowadays with lot of information, like Rasaushadhi are not safe. Some articles are there published by some anti-Ayurveda researchers, I can say. And we have to think whether we can use those Rasaushadhi in our practice. So in pregnancy, yes, I am very much confident that we can use. But those drugs should be very much of standard. And yes, we have to choose those kind of drugs which are prepared with classical preparation, using classical preparations. And the quality of the drug should be ensured before using it. So why we should use, the slides are not moving. Thank you. Why we should choose the Rasaushadhi over the herbal drugs? You all know, but still, to summarize those things, I have put it in two slides, previous two slides. The very first two slides, that potency in low dose, the larger quantity to achieve those results. So we can have the potency in low dose, then rapid onset of activity, kshipram arogyadaitvat. It is said that Rasaushadhi, when patient consumes those Rasaushadhi, the action is immediate. So we don't have to wait for some time. As a herbal thing, we have to spend some days to have know the results of those things. So it's a bioavailability and targeted action. Some Rasaushadhi or some metals or minerals we are using in Rasaushadhi, they are Yoga-Vahi, they are increasing the absorption of the herbs. So bioavailability of the drugs is increased. And targeted action, we always assume that, or we are seeing these results of targeted action of Rasaushadhi. So we can use those, and it's a broad spectrum activity, unlike most herbal drugs. We are having some kind of drugs which are having a very broad spectrum even in antenatal care, like Vasantakalpa. I can say that I'm using Vasantakalpa enormously in my practice, whether it is Laghumalni Vasanta, Madhumalni Vasanta, or Suvarnakalpa Vasanta. But Vasantakalpas are very I can see very effective drugs in treating the pregnancy problems, or it's a fetal growth enhancer, so we can use those drugs. And synergistic formulations, that is Yoga-Vahi property, which I already mentioned. When we choose that herbal drugs to treat, the medicines which are the collection from and harvesting form, different types of quality storage and preparation that is varied with the herbal drugs, like where it is stored, from where it is harvested, from where it is cultivated, or where it is taken for this use. It varies the result. And for Rasaushadhi, it is not like that. If the standard quality raw drug is used, and you can get the same results in the whole batch. So I think the variation we can avoid with the Rasaushadhi. Stability and shelf life, yes, shelf life is more as compared to the herbal drugs. And some Rasaushadhi, we can have the good effect in Krucha Vyadhi also. So you can use the Rasaushadhi for the disease which is difficult to treat with the herbal decoction. The Rasaushadhi can give you the good result. Dose uniformity, yes. If we are giving some Choorna to some patient and we are advising that you have to take this much of Choorna daily, so dose is variable according to the patient's understanding. And yes, if we are prescribing some decoction, patient has to prepare a decoction daily, that also varied. So that's why the Rasaushadhi can deliver the uniform dosage form. And customizability with Anupan. If we can have the different Anupan, we can see the different results also with the same medicine. So I prefer always to use the Rasaushadhi in my practice for many diseases. The quality, safety, and efficacy. We have to check, as I already mentioned, that quality drugs should be used and safe drugs should be used and effective. No doubt these are effective, but we have to ensure the quality and safety also, because we are treating the pregnant patient. Quality of drug should be ensured and should be selected, which is prepared by following classical manufacturing guidelines, as I already mentioned. And these preparations are to be administered with Anupana. As you all know, that Anupana should be prescribed with Rasaushadhi, whichever Anupana is mentioned, or if it is not mentioned, according to disease condition, we can advise the Anupan or we can change it. For some drug I have given, for Garbhapal Ras, Dakshachal, Madhumalni Vasantam, Mishri and Gogruta, Garbha Chintamani Ras, Dhanyak and Mishri Kvat, Dhatri Loho, Gogruta and honey, and Kamdudha Ras, Sita, Jirak and Amalaki. The commonly used drug I have given this Anupana for, and I think with Anupam we can achieve the targeted results. So it is good to prescribe a proper Anupan with the Rasaushadhi, whatever we are going to use. As I already mentioned, for some common pregnancy conditions, I am using the Rasaushadhi since starting of my practice. And these common conditions are like continuation of pregnancy. Many a times when infertility, we are treating infertility patients. We don't want to that the conceived, whatever the fetus should not abort, or that fetal should not have some adverse conditions. So we have to continue that pregnancy at any cost in treated infertility cases. For those conditions, we are having good drugs. Then in threatened abortion, if there is a retroplacental bleed, or sometimes patient bleeds during the pregnancy, 2nd month or 3rd month, there is spotting and the patient is diagnosed as threatened abortion, then we have to treat it immediately, otherwise it will land into the inevitable abortion. So in such cases also we can use some Rasaushadhi. Nausea, vomiting, it's a routine problem we are facing during the pregnancy. And routine antenatal care, as you all know, that we have to give the supplements, iron and calcium supplements during the pregnancy. So for those supplements also, we can use our drugs, and we can replace the iron, calcium, whatever the modern people are giving to the patient, antenatal patient, we can replace those iron and calcium supplements with our drugs. And IUGR, PIH, and gestational diabetes mellitus. These are common pregnancy disorders which I am treating with some Rasaushadhis. Yes, this is a wonder drug, and I am using it very oftenly in the cases where there is a treated infertility or the history of repeated first trimester abortions, or maybe some pregnancy losses, IUD-like things. So you can use this Garbhapal Ras, Hingul, Nag, Vanga, Trichat, and Trikatu, Dhanyak, Jirak, Draksha, and Devdar. These are the contents. And with these rich contents, this drug is very wonderful. And it's already mentioned in the shloka that Masam Pratamam Arambhya. That means you can prescribe this drug right from the first month of pregnancy till Navamasantameva. Till 9 months, you can use this drug. And this is Garbhini Noga Nashartha. Garbhapal, it's a protecting pregnancy. So that is the name given to that drug. But we have to you have to ensure that the quality drug we are using. The Naga Bhasma, which is a very critical ingredient of this drug, if it is not prepared classically or authentically, then it can create a problem. So we have to use this drug from the well-known pharmacies, and as we know that some other what you can say market preparations are also available which are not prepared very much using classical references. So these kind of drugs you have to avoid. And application of Garbhapal Ras is with Draksha Kvat. As you all know, black resins we can get easily. You have to soak those resins, and after 2-3 hours we can crush those resins, and with that we can have the Draksha Kvat, and with that the patient has to consume. And it is very effective in giving the tone to the uterine muscles, and the endometrial receptivity it will increase. And yes, the thin endometrium where there is a nourishment is not there, fetal nourishment is not proper there you can use this drug. And it is a very good drug. It reduces the risk of common pregnancy complications also. That means if we are using Garbhapal Ras in the patient, it will reduce common problems like nausea, vomiting, and afterwards some PIH also. It is some study is going on in NIA that it is reducing the risk of PIH also. So we can use this drug oftenly. And threatened abortion, habitual abortion, as I already mentioned, it is well established in immunomodulator and Rakta Shodhak drug, and it enhances endometrial receptivity and immune tolerance. The fetus has to be accepted by the uterus, and it should be nourished by the uterus. So the environment in the uterine cavity should be very hostile, and that Garbhapal Ras is giving this hostile environment to the fetus in the endometrium cavity. As I already mentioned, some nausea, vomiting in pregnancy, we can add Shankha Bhasma and Kamadudha Ras along with Garbhapal Ras, and this will give very excellent result to you. Within 2 to 3 days, this is my practice, that within 2 to 3 days, the nausea will be covered with this drug. With one dose of Kamadudha and Garbhapal Ras, the patient feels 50% relief. So if the patient is having repeated vomiting and nausea, so you can use this with some combination. And in fever, atisar, kashwas, and breathlessness, I have used this drug in COVID era. like when there was a COVID pandemic and antenatal patients were visiting our hospital. So preventing those patients from the COVID, we have prescribed this drug to everyone, the patient who were visiting our hospital. Because our hospital was a COVID health center that time, converted to COVID health center, and we were examining all kind of patients that time. So we have prescribed this drug to the pregnant patient. And yes, it had given the good results. Good result means the patients are prevented from many of patients are prevented from the infection. This is another drug I'm using oftenly, as I already mentioned, Vasantakalpa. And Vasantakalpa offer the rejuvenation in the body as the leaves and flower blooms in Vasanta Ritu. That's why it is named as Vasantakalpas. And if you can read the sutra of Vasantakalpa, Garbhinyo Tatra Deyo, with Jayanti Pushpa Swaras ke saath dena hai. Sorry, we have to give it with Jayanti Pushpa Swaras, and it is Shrestha in treating pyrexia and Garbhoposhana Uttama. That means it is very much nourishing to the fetus. So where there is a not proper nourishment due to pregnancy complication, due to proper nourishment, fetus is not getting the proper nourishment, we can use this Lagumalni Vasanta. Anupana, Madhu, Dugdha, Jayanti Pushpa Swaras, whatever. If we are using this in IUGR, we have to use with Grita, Dugdha or Madhu. First trimester, indication of Lagumalni Vasanta is nausea, vomiting in pregnancy, habitual abortions, early pregnancy failures, immunodeficiency and recurrent infection, and pyrexia of pregnancy. Lagumalni Vasanta is containing Rasak Bhasma, which is Balya Rasayan immunomodulator action, rich in zinc. As you all know, it's very rich in zinc, and zinc promotes the organogenesis and early embryonic growth. Thus, it prevents the early pregnancy failure. So it is good drug to prescribe during pregnancy. And the Pippali Maricha, they act as Dipan Pachan. So Agni Vardhan we can achieve with Lagumalni Vasanta. And where there is a problem with absorption, we are supplementing many nutritious things to the pregnant lady to have the good fetal growth. But the absorption should be very nice. The Agni of that pregnant patient should be very nice. Then only that all nutrients can be absorbed. And to increase the appetite, this Lagumalni Vasanta, Suvarnakalpa Vasanta Kalpa, this helps greatly in such kind of conditions. So this is one drug. Another drug is Suvarnakalpa Vasanta. As you all know, the Suvarna is improving cognitive functions also. Over the Lagumalni Vasanta, where there is a problem with immunological problems, like patient is with torch infection, and there is a recurrent pregnancy loss, or there is some unknown infertility or some unknown kind of repeated pregnancy losses. We are not getting the result with n number of investigation. In those cases, we can prescribe the Suvarnakalpa Vasanta, because Suvarna is Ojavardhak drug, and it increases the Oja of pregnant lady as well as the fetus. So Suvarnakalpa Vasanta, we can use 1 to 2 tablets daily as per need. Anupan will be Draksha Kvat and Godugdha. Suvarna is potent Rasayan and Prajasthapan, fertility promoting agent. It stabilizes the pregnancy by enhancing fetal immunity, promoting cellular differentiation, and supporting hormonal regulation. So it is preventing the repeated pregnancy loss. IUGR and in preeclampsia cases, IUGR we can use where there is a fear of preterm delivery also. There, if the patient, there is a fear that we have to intervene this patient preterm at the 34 or 35 weeks. Then instead of Laghu-Malini Vasanta, you can choose the Suvarna-Malini Vasanta, because the Suvarna is, as I already mentioned, it is Oja-Vardak. And you all know that Oja is the thing which is going to survive this delivered child after outside the uterus. So Oja-Vardhan is very much necessary before the patient delivers. So where there is a fear of preterm deliveries, or along with that IUGR is there, you can use the Suvarna-Malini Vasanta. Even if the fetus delivers at 34-35 weeks, the survival chances of the fetus is very high with this prescription. Skip. This is again one more drug, Madhu-Malini Vasanta. And please read the last two lines. Garbha vruddhi karaschaso garbhininam sukhavaha. That means it's a very pleasant drug, very, what you can say, good for the pregnancy, and it enhances the fetal growth. So as it contains the egg, hingula and dadima, so these drugs and Trikatu, these drugs, Trikatu will have the Dipan Patchan action, and the egg will have the nourishment. So the fetus is inside the uterus will be well nourished with this drug. So in IUGR cases, you can use this with milk grita once or twice a day. And these are the contents, as I already mentioned. Egg and priyangu. These are the main two things which are nourishing the uterus, nourishing the fetus, and which are responsible in the fetal growth. Second trimester is the crucial phase for organ development, and the formulation fulfills the increased nutritional need. If we prescribe Madhu-Malini Vasanta drug routinely in the second trimester, because second trimester is the period where the maximum fetal growth will be there, and the third trimester, the early 2 months of the third trimester. During that period, if you use the Madhu-Malini Vasanta-Kalpa, then there will be a good fetal growth and reduction of IUGR. As you all know, IUGR is the third trimester condition many a times, late second trimester or third trimester condition. So we can prevent the IUGR cases. There is one study conducted in Jamnagar that the 100 patients of normal ANC compared to the supplemented ANC with Madhu-Malini Vasanta, the rate of IUGR was reduced 50% in the treated group, the Madhu-Malini Vasanta treated group. So that's why it should, if we prescribe this routinely drug in second and third trimester, early third trimester, we can reduce the rate of IUGR. In the patients where there is a history of IUGR or history of IUD because of not getting good nourishment, placental aging, then we can prescribe this drug in second and third trimester. This is my own experiment. I have chosen this Madhu-Malini Vasanta for my PhD work. And I have done the animal study, experimental study, before the clinical study. And there were 3 groups, one with therapeutic use of Madhu-Malini Vasanta, the pregnant rats, the study done on pregnant rats. The one group was with Madhu-Malini Vasanta regular dose, the therapeutic dose, and the other group is a placebo, and the third group is to have this safety study. It was the 5X group, and the whole 3 groups we studied. I was daily feeding those rats, And for 21 days, starting from the first day to till their complete pregnancy period, that is 21 days, we have given Madhumalini Vasanto to those rats. And we assessed their weight gain. The weight gain was much in Madhumalini group rather than control group. And we assessed safety also. We have done all the investigation on 3 groups, and the drug is found very safe. It is not having any effect on LFT and RFT. All parameters were normal. And after that, we conducted the clinical study. And in the clinical study, there were 2 groups. That one treated with Madhumalini Vasanta group, and the other one treated with alamine sachets, amino acids. As you all know, amino acids is the conventional stand-alone treatment. When I conducted this study in 2000, I started this study in 2000 and completed in 2006 around. So that time it was the sachets, amino acid sachets were available, and we have given to this control group, and we studied the weight gain. This is 300 almost weight difference is there in both the groups, and 300 grams is the very good weight to reduce the complication in the neonates with the IUGR cases. So that is a great achievement we had, and this paper is also published. You can get this paper. For routine iron supplements in the pregnancy, as you all know, our food is not containing much iron. Whatever we are consuming nowadays, it is not fulfilling the iron for the pregnant woman. We have to supplement externally with any iron supplements. And we are having many medicines for those kind of supplements. And those drugs are Loha-Mandoor, Mandoor Bhasma, Shatavari-Mandoor, Dhatri Loha, Navayas Loha, and Saptamrut Loha. In my treatment, I am using Dhatri Loha for every patient, almost for every patient. And to whom, where there is some kind of other element like pregnancy-induced hypertension and the antenatal supplement I want to give, then I will choose the Loha-Mandoor. Because the Loha-Mandoor works on pregnancy-induced hypertension, edema. It will reduce the edema in the patients. So as per need of the patient, we are having many drugs and looking into the patient's need. If the patient is having the Amla-Pitta condition or the nausea vomiting, and still we have to give the supplements, iron supplements, we can choose the Dhatri Loha. Or if the Agni-Mandya is very severe in patient, and whatever iron we are going to give the patient is not going to absorb. So in such cases, we can choose the Navayas Loha. So looking into the patient's condition, we are having many drugs that we can do the permutation and combination. After giving Navayas Loha, you can increase the Agni, and after that you can shift to Dhatri Loha. Because Navayas Loha is containing Chitraka. So for giving it for longer period, it is not advisable. So we can shift it to Dhatri Loha after that, or maybe the Mandoor Bhasma. So permutation combination we can do in the supplements. And Saptamrut Loha, my just pilot study I have conducted, where there was the ophthalmic problem associated with the pregnancy. That the pregnant mother is having large specs, and she don't want to her child to be wear specs from early childhood. So this needs a 10-15 years follow-up with that patient. So just the 10th patient given me the follow-up, and I am happy that supplementing Saptamrut Loha in those patients can reduce the specs in the child. So I'm going to publish this study in recent days. So that is the beauty of Ayurveda, that you are having many supplements, and wisely you can use them for routine iron supplements. Dhatri Loha, already I mentioned. We have just completed our study sponsored by Ministry of Ayush in pregnant ladies. It was conducted on 1,000 cases, 1,000 trial group and 1,000 control group. In trial group, actually, it was not only for the Dhatri Loha, it was the comprehensive antenatal care offered by Ayurveda. Like we started with Shatavari Ghruta in the 4th month with Dhatri Loha and Mukta Shukti-Vati. That is calcium and iron supplementation. And in the 9th month, Pichu and Anuvasan Baste. And with these treatment, we screened 5,000 cases and we get the 1,000 out of it who followed total 9 months. And the money given by the Ministry of Ayush is 1.5 crore to this project. And last month only we completed this project and we are going to submit this report to the ministry, and after that it will be published. But throughout 9 months, starting from the 4th month, the Dhatri Loha was continued, and the parameters in both the groups are showing same HB level in both the groups. That means we are definitely supplementing the iron need, whatever need there in the pregnancy with Dhatri Loha. And the additional benefit of it, that it is reducing the complications which are adverse effects which are related with the iron supplements, like constipation, sometimes diarrhea, sometimes irritable bowel. So if we supplement the iron, whichever available in the market, many patients are having those symptoms. With Dhatri Loha, we are not finding those kind of symptoms, and it is reducing the nausea or vomiting like things. So Dhatri Loha we can definitely use and recommend during the pregnancy for iron supplements. I will skip this slide. As I already mentioned, prophylaxis we can use, but in anemia also we can use the Dhatri Loha. Punanawa Mandur. Mandur is the actually, than Loha Bhasma, Mandur absorbs very easily in pregnant patient. So if the pregnant patient is having edema and PIH, you can choose the Punanawa Mandur for iron supplements. And it is very well tolerated by the patients, and it is very useful. Many research articles are published on the Punanawa Mandur. Now Ayas Loha, I already mentioned. Nausea and vomiting in the pregnancy. We generally come across these complaints in the pregnancy. And whatever I am using for such kind of patient, we are having in All India Institute of Ayurveda, Delhi, we are having daily 80 to 100 antenatal care patients for routine antenatal care. And 70 patients we are delivering in monthly in there. So these patients we are offering 99% with Ayurveda treatment. We are managing those patients 99%. Whenever there is emergency, or if we are going to have the cesarean section, then only we are using allopathy drugs like antibiotics, analgesics and all. As you all know, we have to use those for the many of the regulations also. So those kind of drugs we are using. Otherwise, throughout the antenatal care, we are managing all kind of things with our drugs only. And for nausea vomiting, I am using Shankabhasma, Lagusutchekar, Garbhapal Ras, Kamduda and Lagumalni Vasanta. Pravada Panchamrut, this is again the wonder drug, which we can use if the patient is having acid peptic disease and she is pregnant and she is vomiting repeatedly, there you can use Pravada Panchamrut, and it gives the nice results with Pravada Bhasma, Kapardik, Shankha, Shukti and Otik Bhasma. You can get 2 types of Pravada Panchamrut, so you can use any one of this. Threatened abortion, already I mentioned, in threatened abortion cases, there is a bleeding, and we have to arrest bleeding, and with the arresting bleeding, we have to nourish the fetus. The fetus should get good nourishment and good growth. So, to arrest the bleeding, Kamdudha, Pravat Panchamrut, Pravat Pishti, Chandrakala Ras, these are very useful in arresting the bleeding. And for fetal growth, Garbhapal Ras, Suvarnakalpa Nivasanta and Lagumal Nivasanta, you can supplement with those. So in combination, we can use. Pregnancy-induced hypertension, as I already mentioned, nowadays we are facing major two problems, gestationally induced diabetes and pregnancy-induced hypertension. Because of this altered lifestyle, we are facing those two issues more. And for that, we are having good remedies with Ayurveda. Pregnancy-induced hypertension, Loha-Mandoor, Suchekhar, Pravat Panchamrut and Mukta Pishti. As this is, we call it as pregnancy-induced hypertension as Pitta Pradhan Vyadhi, Pitta Vrutavad sometimes, and aggravated Pitta. So we can treat these conditions with those drugs. Gestational diabetes mellitus, and the drug which I am using in my practice is Vasanta Kusumakar Ras. Vasanta Kusumakar and sometimes Chandraprabhavati. Vasanta Kusumakar is and Sarvamehar Kashai. I am using this with Sarvamehar Kashai and Vasanta Kusumakar. We have published one study that patients pre-diabetic and the mild diabetic cases, we completed 30 cases with Sarvamehar Kashai and Vasanta Kusumakar Ras versus metformin, which is a routine supplement by modern medicine people. And comparison of both done, and the paper is published, and we have the very good glucose control with Chandraprabha and Sarvamehar Kashai. And yes, fetal growth. For fetal growth, additionally we are using their Vasantakalpa. What are the clinical evidences whether these drugs are safe for using? So few articles are published on this drug. This is on Garbhapal Ras. Some are in the experimental studies, and some have done the clinical studies on Garbhapal Ras. And in each and every study, it is said that Garbhapal Ras is not having phytotoxic effects, and it's not having any changes on LFT, RFT, and on the contrary, it is having good effects on HB percentage, and it is proved safe for using during pregnancy. Dhatri Loha, many studies are there mentioning Dhatri Loha, how we can use, how it is increasing HB percentage during pregnancy, and what is the effect of RBC on RBC, MCV, MC, HC, and all studies are published and they are increasing nicely, MCV and all parameters. Loha-Mandoor, again some articles are published on Loha-Mandoor. Better improvement in HB percentage and improvement in symptoms of Vaman, Aruchi, Panduta, Kas, Udarshul, that is also in one study, mentioned in one study. Vasantakalpa, that is my own article which is published. As I already mentioned, I have done the study in IUGR patients. And Lagumalni Vasanta, improved progesterone level, all patient 100% completely full-term pregnancy. It is mentioned that it is very good in continuing the pregnancy. It is very good for avoiding the regular pregnancy losses, and it is good drug to prescribe, and marked improvement in IUGR symptoms. AFI, weight, and the abdominal girth is increased with Lagumalni Vasanta. Kamdudha Ras, it is Kamdudha versus Dhatri Loha, the one paper is published, and it is highly significant in improving the symptoms like weakness, pallor, fatigue, and HB percentage is increased with both the. I have conducted one study. The Google form was circulated. We are having one group of obstetricians, Ayurveda obstetricians, where the group members are 100 plus. And we have conducted one study that how many of those are using Rasaushadhi and how frequently and for which are those drugs and for which symptoms they are using. So the responses we received are total 83, and they are using the Rasaushadhi for various reasons in their practice, and those reasons are also mentioned. Almost 94% obstetricians in that group were using the Rasaushadhi, and the drugs which they were using are those drugs which I already discussed till this time, since from the first slide. Garbhapal Ras, Lagumalni Vasantar, Chandrakala, Pravapishti, Dhatri Loha. There are these drugs they are using. Sometimes other drugs also they are mentioned, that other drugs they are also using. That is Motikyukta Kamaduda, Kapardik Bhasma, Lakshmi Vilas Ras. Lakshmi Vilas Ras they are using for the pregnancy tachycardia. Multiple times we are getting the patients without any reasons. There will be no hyperthyroidism or no other anemia like things, but still there will be tachycardia. There is no cardiac involvement is there, but still patient will get the tachycardia. In those cases, Lagumalni Vasanta works very nicely. They are using Mandoor Bhasma, Suvarna Bhasma, then Chintamani Ras, Shwaskash Chintamani Ras also. Rarely. Any reactions? It was in the questionnaire there we mentioned that if you found any adverse reactions, then please mention it. To 64 persons were there that we documented there is their responses, and 62 were saying that any adverse effect we haven't noticed. And one person mentioned that there was a itching and vertigo with Garbhachintamani Ras. Alteration in LFT, 42 out of 62 respondents mentioned that there is no significant alteration in hematological parameters. 10 respondents mentioned that effect on lab parameters was assessed, and there is no change. One respondent mentioned marginal change in RFT, and one respondent serum creatinine was raised in Garbhachintamani Ras. So generally I am now using that drug also. Untoward effect, as I already mentioned, majority, no significant ill effect has been mentioned on the fetal health parameters. Majority have mentioned that positive effects on fetal weight, other growth parameters, amniotic fluid index, placental grading, and positive effects in IUGR. They have mentioned this. This is one case I want to discuss it was treated by me in 2015 when I was practicing in Pune. This patient was of repeated abortions, and when she visited our hospital, already 4 abortions were there, and that patient visited with all her reports done. The reports are with her since 2011, it was there, and the whole karyotyping on all things were done, and they were not getting any problem except there was torch infection, the IgG marker, not IgM, but the IgG markers were increased. And that patient treated with this much drug only, because actually I advised her Virechan and Basti, but she was not ready to take any treatment because she was working outside the Pune, and I prescribed these drugs only to her, and I did the cesarean section the 34 weeks because of some accidental problem with her. we did the cesarean section, and 1.7 kg male child she got. See, you can see the first abortion, missed abortion, the second abortion, missed abortion at 2.5 months, third missed abortion, fourth missed abortion. That means fetus is not getting the nutrition very nicely, and due to lack of nutrition, fetus is dead inside, and it is, the USG report was with her that missed abortion. This is discharge card of my hospital, Said Tarachand Hospital, Rastapet, it is there in the Rastapet, and I did the cesarean section of that patient afterwards. So with those 3 drugs only, the pregnancy continued and survived. What are the current challenges? Even if I'm saying that I'm using since 29 years in this field, Rasaushadhi, still some articles comes frequently in our reading. So these are the challenges that we have to prove the efficacy, we have to prove the safety, and we can do with robust research on those Rasaushadhi. Future scope, strengthening the pharmacovigilance and adverse drug reactions, ADR reporting, and well-controlled clinical trials with double blinding and in vivo safety toxicity studies with large sample sizes in pregnancy with Rasaushadhi as an intervention. We can do that. And development of mammograms for each formulation outline the risk and benefits. Take-home message, we can use the Rasaushadhi, often offering potent, rapid and targeted therapy with significant advantage over traditional herbal medicines, provided standard classical preparations and clinical protocols are followed. Consideration of risk-reward ratio while prescribing the Rasaushadhi in pregnancy. Even if there is a minimal risk, still we have to prescribe because the benefits are much more than that. So we can use the medicines during pregnancy. Classical standard medicine we can use very nicely and have a good pregnancy outcome, because as an Ayurveda fraternity, our aim is to give the good healthy child to patients, that is Supraja, and we can achieve this with our Garbhini Paricharya, the whole management, the nutrition, diet supplements, and with addition of these drugs, we can have the better outcome of the pregnancy. Thank you. Thank you, one and all. I hope I finished in time. I'll close this.
Thank you, Professor Dr. Sujata Kadam, for that inspirational presentation on vital role of Rasaushadhi in obstetrics. And I would like to present you a token of appreciation presented to you by the organizing committee of Rasashastra Sambhasha. I would like to invite Professor Jayawardena to present this token of appreciation to Professor Kadam. Thank you, Madam, for coming all the way from India to share your expertise with us. And next, I would like to invite Dr. Mukesh Chowda, who serves as the Senior Manager of Healthcare Services at Solomix Herbaceuticals Limited, India, a seasoned clinician with over 25 years of experience. He brings a rich blend of clinical acumen and research expertise. Dr. Chowda has played a pivotal role in driving research initiatives at both Sri Dutta-Papeshwar Limited and Solomix Herbaceuticals. In his presentation, we'll share some fascinating insights on supporting male reproductive health with Ayurved interventions. Over to you, Doctor.
Maybe it's not working. Good afternoon, everyone. Namaste. And I would directly come to the topic. And the topic which has been given to me is, can we address male reproductive health issues through Ayurveda? Now, before completing the presentation, I would say yes, definitely. And Madam has also addressed the issue that we require documentation. And for documentation, research is essential. So in this presentation, I would like to share some views. Means we have done documentation, I will share my views also, and we will present some data that at SDL, Sri Dut-Papeshwar Limited, how do we do the documentation or what is our approach. Now, since we are talking in Sri Lanka, I will also present some burden of disease. Now, first we start with male infertility. Now, when we talk of male infertility, everyone knows that the global burden is around 8 to 12%. And in this 8 to 12%, okay, 50% contribution is male factor. And when we talk of male factor also, 90% of male reproductive issues are related to sperm count, sperm concentration, and sperm motility. Now, that red part which I have highlighted, it is the Sri Lankan scenario. So there is a study published, okay, which says that those Sri Lankan men who attend the fertility clinics, okay, they have found that in almost 30% of male, the sperm concentration is less than 15 million. Now, this sperm concentration, these are international definitions. I'll come to that definition also. WHO definition, and in almost 35% of male, the sperm motility is, total motility is less than 32%. And what are the predisposing factors? Now, predisposing factors include smoking, alcohol, obesity, exercise, and tight undergarments which are used, or even it is very common in athletes. So basically they improve the scrotal temperature and there is a reduction in sperm count. When we talk of virility related issues, okay, the most common issues are erectile dysfunction, premature ejaculation, and low or lack of desire. Now, it's a simple rule that in 40% of men, after the age of 40 years, they experience some degree of erectile dysfunction. And a survey was done, okay, it was an international survey. It also said that those men who attend the sex clinics to address their sexual health issues, 50% of them, they suffer from erectile dysfunction. So these are very common issues. Now, this erectile dysfunction, these diabetics are prone to erectile dysfunction 2 to 3 times. Now, this is a serious issue in Sri Lanka. I have read several articles. Now, when we talk of Sri Lankan burden of diabetes, 12% of Sri Lankan population, it suffers from diabetes, and adult population, and 16% of Sri Lankan adult population, they are suffering from pre-diabetes. So, this pre-diabetics, in next 3 years' time, they will develop diabetes. Now, one of the major complications of diabetes is also male sexual dysfunction. It is related to nephropathy. So this has to be addressed in Sri Lanka. And secondly, we all know that sex is in mind, it is not in the organ. In 60% of cases, there is a psychogenic causes. Those who are suffering from depressive disorders or anxiety, okay, this sexual dysfunction is very common. And side effect of various drugs. Now, as the longevity is increasing, our aged population, they suffer from prostate issues. So 5-alpha reductase inhibitors like finasteride are used. One of the common side effects is sexual dysfunction. Then neuropsychiatric drugs or even anti-hypermedicines like beta blockers, they cause erectile dysfunction. So when we treat a patient, we have to keep this in mind. What is the cause? When we identify the cause, the treatment becomes very easy. Now, whether it is male infertility or it is virility related issue, in modern medicine or in Western medicine, how do we treat? Okay, first of all, we have to keep in mind that these are interrelated. These are interrelated, that infertility and sexual dysfunction, they usually coexist. So when we treat a patient, we have to, proper patient workup is very important, and we have to address HPG axis, hypothalamic, pituitary, gonadal axis. So the treatment becomes very easy. We have to identify and treat the cause and the comorbidity. If a patient is suffering from diabetes, is suffering from hypertriglyceridemia, okay, which are one of the leading causes of insulin resistance. And we all know insulin resistance leads to obesity, and both this, insulin resistance, diabetes, obesity, they reduce the testosterone levels. They reduce the testosterone levels. So weight loss is very important if the person is obese or overweight. Now, when treating, we all know, we have heard Viagra, sildenafil, tadalafil, okay, this is the first line of treatment in modern medicine, okay. And what do? They are basically called as 5 PD inhibitors, phosphodiesterase inhibitors. They improve the blood flow to the penile tissue, okay, there is engorgement, there is rigidity, okay, but they are not addressing the root cause. And these medicines have various side effects. One of the most common side effects is landing into emergency department. They cause priapism, so that bloodletting has to be done. Otherwise, patient will not have relief. Then, when we talk of premature ejaculation, I don't think medicine treats it. Patient requires counseling, and he also requires some exercises. Okay, stop and start technique. Then, low libido. Low libido, psychotherapy, counseling is very important. And lastly, weight loss is very important if the patient is overweight. Now, what does Ayurved say? Ayurved says the same thing. It was written in Sanskrit. Ayurved says the same thing. Apatya sandan karam yat sadya sampraharshanam. This is Vajikaran or Vrushya Chikitsa. It is not that pleasure medicine. No, the primary objective is healthy progeny and healthy virility. So this is Vrushya Chikitsa. And for this, Ayurved has defined 3 categories of drugs. Okay, Shukra Shruti Karam Kinchit, Kinchit Shukra Vivardhanam, Shruti Vruddhi Karam Kinchit, Trividham Vrushya Muchyate. So 3 types of Vrushya medicines. Shukra Shrutikar, okay, which improve the orgasmic functions. When we talk of Shukra Vruddhikar, okay, which improve spermatogenesis. Examples are Kokilaksha. Examples is Kapikachu, Ashwagandha, Hygrophila spinosa, and medicines which do both Shukra Shrutikar and Vruddhikar both. So Ayurved has well defined, and it's not just herbs. We are also talking of mineral medicines. I'll come to that. Now, ultimately, what are we treating? We say that we are treating Shukra Dushti. Now, how does it, what we can say, manifest? So say Shukrasya doshat, klaibyam, aharshadam, rogi va, klibam, alpayu virupam va, prajayate, na chasya jayate garbha, patati, prasavati api. If in case of Shukra Dushti, what happens is klaibya. Klaibya is impotency, erectile dysfunction, aharshanam, lack of desire, rogi va, klibam, alpayu virupam va, prajayate. The progeny can be impotent, it can be short-lived, it can be malformed, okay. If there are chances that there may not be conception. If there is conception, there are chances of miscarriage. So we are treating both. So in the previous slide, that this erectile dysfunction or sexual dysfunction and infertility, okay, they are correlated. Ayurveda says the same thing. And what is important, that previously, that in 60% of cases, this problem is psychogenic. In 40% of cases, there is an organic cause. And this also Ayurveda has defined. I will read out one slok. Shayad, Bhayad, Avishramvad, Shokat, Stri Dosh Darshanat, Narinam, Arasadnatvad, Avicharat, Asevanat. See, the first cause is Shayad. When we talk of Kshaya or Dhatu Kshaya, or we talk of tissue depletion, it can be because of age, it can be because of disease, it can also be because of overindulgence in the activities. Secondly, all other causes are related to mind. Okay. Or Vishrambha, lack of intimacy. Then we talk of Shok. Shok is grief. We talk of fear of performance. Stri Dosh Darshanat, incompatible female. We are also talking of Narinam Arasadnatvat, frigidity. Then we are talking of avicharad. There is disinterest. Last is asevanad. A person might be following celibacy. So these reasons are already defined. So we have to identify the cause and we have to treat. Now when we talk of herbal medicines, okay, the herbs, there are many. These are some of the prime herbs: Mucuna pruriens, or Tribulus terrestris, Vidania somnifera, Chlorophytum borevillianum, Asparagus racemosus, Bombec ceiba, Hygrophila spinosa, Myristica fragrancis, simple nutmeg, which is available in Sri Lanka also, Strychnus nux vomica. So these all drugs, they improve virility also, and they have spermatogenic action. And I have missed one herb, which is Cinnamonum zelenicum. Ayurved says that it is Shukrajanak. See, this is the beauty of Ayurved. When we are talking of Viagra, when we are talking of modern medicine, okay, they are symptomatic. They don't increase the sperm count. They are not spermatogenic. But when we are talking of cinnamon, it is widely used in diabetes management. Plus, it has this spermatogenic action also. Now, madam had quoted one example of Vasant Kusumakar Ras. Vasant Kusumakar Ras, okay, they knew that diabetes and impotence are interrelated. So in Vasant Kusumakar Ras itself, it is Vrusha. It is used in the management of erectile dysfunction. So this broad thinking of Ayurveda we have to keep in mind. When we are talking of metallics and herbometallics, some of the common medicines are Suvarna Bhasma, Rajat Bhasma, Vanga Bhasma, Shodhit Shilajit, Trivanga Bhasma. Pushpa Dhanvaras is widely used in Sri Lanka. And I think we had met several doctors. They are using this Pushpa Dhanvaras in the management of male and female infertility both. In fact, they are using it in the management of polycystic ovary syndrome also. Vasant Kusumakar Ras I have already mentioned, Pramal Bhasma and Purna Chandrodaya Makartva. These are some of the few. There might be some more medicines also. Now, okay, these are individual ingredients. Okay, they are mentioned in Ayurveda that they are effective as in spermatogenics also, or to improve virility. Now, when we conceptualize a proprietary formulation, when we combine this, do they work? And for this, we require documentation. And I have completed 27 years in the company. Thanks to Ranjit sir and his family, what we were taught, we were also juniors, that you have to read the text. So our homework starts from understanding the text. Now I give an example of Ashtang Hruday. What is Vrusha? Apatya Santankaram, yet Sadyam Sampraharshanam. Apatya Santankar is healthy progeny. Sadyam Sampraharshanam is increase in virility. Okay. Now keeping this in mind, to develop this formula, when we worked on Bij Pushti Ras, we kept this thought in mind and we developed a formulation. Now this formulation offers the benefits of Suvarna Bhasma, a metallic preparation, Purna Chandrodaya Makardhvat, supported by the herbal ingredient. And we have a tradition that for our new formulations, we conceptualize a slok. Now it's easy to communicate to the Vaidya. When we conceptualize this, Apatya Santanakara, Bija Dosh Nivaran, we have to overcome Shukra Doshti, Bija Pushtya Purushasya, we have to nourish the Shukra Dhatu, and this product is called as Bij Pushti Ras. Now we have developed the formula. What next? Next is characterization. We should know what we are offering our customers, especially when we are adding metallic ingredients. It has Suvarna Bhasma. Now if you scan our QR code, which is available on all the products, you can download our SDS monograph. Now in this SDS monograph, we say purity and surety. We are adding Suvarna Bhasma, best quality Suvarna Bhasma, consistently more than 95% elemental gold. But this is fine, these are our routine things. What we have established is, it is non-genotoxic, non-mutagenic, non-neurotoxic. So our customers are sure that this medicine, SDL medicine, is not going to harm the current generation also and the future generation, because ultimately this is for a healthy progeny. Now this part is fine. We know that, okay, we recite some sloks, and many companies try to convince the Vaidyas that this is based on Ayurved. No, but this era is evidence-based Ayurved. When we talk of evidence-based Ayurved, this potential has to reflect in performance. So we have to do efficacy studies also. We are doing preclinical studies. Now I will present one preclinical study where we have proven that this Bij Pushti Ras has spermatogenic potential. It works on hormonal levels. After completing this study, we also have completed recently a clinical study in 101 patients in National Institute of Ayurved in oligospermia cases. This also results oil. And what next? Now ultimately our products are safe. Our products are effective. The most important question is how do they work? So to understand the mode of action, we have initiated some studies. Now, like we know, Viagra is 5-PD inhibitor, phosphodiesterase 5 inhibitor. So our medicines also work in the same way. That's stroke. Sadhya sampraharshanam. Sadhya is immediate. So our acharyas knew this. Probably we have not documented. So Gokshur papers are published. It contains one chemical which is called as protodiazine. Now this protodiazine is an PDE5 inhibitor. So probably there are many medicines which we don't know. Now the spermatogenic products like Bij Pushti Ras, okay, we have to understand the pathway. So some pathways have evolved like mTOR pathway. mTOR pathway initiation or stimulation means spermatogenesis is happening. Because all these things, I think madams will agree, these are all hormonal. Like in PCOS, they will talk on PCOS or they have already talked, we talk of LH-FSH ratio, no? LH-FSH ratio is equally true in males. Because of LH-FSH ratio, there will be sperm production and there will be testosterone production also. This LH is basically Leydig cells, okay? They produce testosterone. And when we talk of FSH, they stimulate the Sertoli cells, which produces sperm and also the seminal fructose. So these are all interlinked. Now this work we have done in prestigious institute, and these are few of our collaboration. One of our collaboration I think is in Sri Lanka also, Kelaniya University, where we have characterized our Rajat Bhasma and some more experiments are going on. Basically today's work, which I will highlight, is preclinical work on Bij Pushti Ras, which is conducted in an esteemed institute, National Institute of Research in Reproductive and Child Health, Mumbai. It's an ICMR body. Secondly, National Institute of Ayurved. And one more study on Sheila Prong Special, which we have completed in prestigious Ayurved hospital, KLE. Now first, I come to the preclinical study. Now preclinical study is required. See, almost this product is in the market for 20 years. But still, to document it, we had to do a preclinical study. Now this preclinical study was 17-beta estradiol induced oligospermia in rats. Everyone knows estradiol. Estradiol is present in males also and females also. Female, it is more. In males, testosterone is more and estradiol is less. In male body also, the function of estradiol is bone health, cardiac health. Okay, it is also important for libido. Now, when we injected 17-beta estradiol in male rats, what happens? There is increase in 17-beta estradiol levels, which compensatory decrease in the testosterone levels. And now here we had given 54 days treatment to rats. Vista rats were used. Now why 54 days? In spermatogenesis, we all know in humans the average cycle is 74 days. In rats it is 52 days. So the treatment was given for 54 days. Now and we had studied this Bij Pushti Ras in 2 different doses, which were equivalent to human therapeutic dose of 4 tablets and 6 tablets. After 54 days of treatment, what we observed, both the treatment worked. Both the treatment, whether it is high dose or low dose. So high dose and low dose, there was not much difference. It means 4 tablets are also sufficient. And this was the message to the Vaidyas. After 54 days of treatment, there was reduction in estradiol level, which was the toxicant, and there was increase in testosterone levels, which is the main spermatogenic hormone. So this is what we had proved. After this increase in testosterone levels also resulted in an increase in daily sperm production and seminal fructose levels. This is the effect of increase in testosterone levels. Then motility is also improved, percentage motility and progressive motility. Keeping this in mind that we know our product works. Now we said that okay, we will study it in a larger sample size, almost 100 patients in National Institute of Ayurved. So we said that okay, this is a rising issue globally. We said 8 to 12% of global population is a big amount. If we can help some of this population, then, but we require proper documentation. So here in this clinical study, this was a 90-day study. We completed 101 patients. Now, how did we select the patients? The patient's selection was patients suffering from oligospermia on 2 different occasions, 1 week apart. Because there may be physiological variation in the sperm count. So usually the benchmark is on 2 separate occasions, sperm count has to be low. Now what WHO says? Sperm concentration less than 15 million. Sperm concentration means per ml. Sperm concentration is per ml. So we wanted to see after 90 days of treatment, does our intervention increase the sperm count? In those patients where sperm count is less than 15 million per ml. And in the secondary objectives, we also decided that other parameters, sperm parameters like motility, we also studied testosterone levels, and one of the major issue was to study safety. See, no one told us to do the clinical study. This product is in the market for 20 years. We know it works. But safety in 100 patients was very important. So safety also was one of the major issues. Means the challenges which we are facing from the field. Now, what does WHO say? Now, WHO, World Health Organization, this document or this criteria is used all over the world. Now, what does it say? That volume, normal volume should be 1.5 ml, concentration more than 15 million per ml, total concentration means per ejaculate, it has to be more than 39 millions. Morphology, 4% should be normal form, 58% vitality means live forms, progressive motility is 32, and total motility is 40%, progressive and non-progressive motility. Progressive means forward direction, non-progressive means they move left to right. So this is the WHO criteria. All our patients which we had recruited had sperm count of less than 15 million at the baseline visit. After 90 days of treatment, there was increase in sperm concentration also and sperm count also. So this was one of the biggest documentation that the product has not only worked in preclinical model, but it has also worked in clinical model. Apart from this, because count increase, we also observed there was increase in motility and there was increase in progressive motility. Now, because progressive motility improved, there was reduction in grade B, which is non-progressive motility and immotility. So first thing was clear that, okay, this product improves sperm count. It also has positive impact on improving the sperm motility. Then comes sperm morphology. Increase in normal form and reduction in abnormal form. When we look at vitality, vitality also improved. Now, why vitality improved? Because of antioxidant effect of the ingredients. Because there are several herbal ingredients also. We know Suvarna, Bhasma. Okay, it is one of the well-known antioxidant. Makardhwaj is also a well-known antioxidant. Then comes the testosterone levels. Yes, there was definite increase in testosterone levels after 90 days of treatment. So product worked. Okay, so it balances indirectly. What is the mode of action? Mode of action is it balances the LH-FSH ratio in males. This is the mode of action. Then comes safety. After 90 days of treatment, there was no alteration in SGOT, SGPT count, in creatinine. If you look at this slide, in fact, that creatinine reduced. It was less than the normal also. If you look, I think it's 0.85 to 0.80. It reduced. It was not significant reduction, but what was important is no signs of renal toxicity were seen. So this boosts or increases the confidence of our Vaidyas. Now, apart from this, we also said that, okay, does it improve the virility? So one small scale was used, although this was not a validated scale. It was reverse scoring. Higher the score, more bad the virility. So after 90 days of treatment, what we found out, there was reduction in this score indicating improvement in erectile dysfunction or orgasmic dysfunction. So this was the basic documentation, but our main objective was, does it increase the sperm count? So yes. Now here also in Ayurvedic terms, what we can say, it is Shukra Shruti Vruddhikar. It's not just Shukra Vruddhikar. Our next product was Shilapravam. This is a recent study. Again, this is a CTRI registered study which was done on pilot basis in 30 patients who were suffering from male sexual dysfunction. This is again an herbo-mineral formulation. Now here, a very well-known validated scale was used. It is called as IIEF 15, International Index of Erectile Function. This is widely used scale, validated, used in majority of researches which are being done to assess the sexual function of or virility in the patient. Now it has 15 domains. And in this 15 domains, the maximum score goes to 75. Maximum score is 75. Okay, the score has to improve. Score has to improve. And here, and in this score, in International Index of Erectile Function, majority, 4 domains are studied. The first domain is erectile function, orgasmic function, sexual desire, and intercourse satisfaction. There is one more domain, it's overall satisfaction. But these 4 domains are studied, and we had studied these domains. And our major inclusion criteria were patients in the age of 41 to 60 years who had difficulty in obtaining erection, maintaining erection, or penile rigidity. So this, again, based on a validated scale, we had recruited the patients, we had given treatment for 45 days. There were 3 follow-ups, baseline, after 15 days, and after 45 days of treatment. What we observed, there was definite improvement in IIF 15 score. Increase in score means patient has responded to the treatment. Okay. Then when we talk of erectile function domain, there was an improvement. In orgasmic function domain also, there was improvement. We did not see improvement in the desire domain. Probably we'll study it in a higher sample size, or we don't know, Ayurved medicines also may not be improving the desire. But this was inconclusive. So we did not see any change or improvement in the desire. Intercourse satisfaction, yes, they reported there was definite improvement. One more, the beauty of this study. In addition to this IIF 15 scale, we also used a PEDT scale, premature ejaculation diagnostic tool. Now this is also a separate scale. Here, again, this is a questionnaire based on 5 questions. Each question, maximum score is 4, so total gradation, the scoring goes to 20. For premature ejaculation, the score, usually it has to be around 8 or more than 8. Here also we saw that there was reduction in the score because score has to go down. One more score which we had used, we are talking of performance anxiety. We had used HAMA, Hamilton Anxiety Rating Scale. Improvement in virility reduced the anxiety. So this was again one of the features or characteristics of these studies, that along with counseling, along with 45 days of treatment, improvement in erectile functions also reduced the anxiety, so that fear of performance reduced. In this study, we did not see any change in testosterone levels. Now we think, in the previous study, the change in testosterone levels was seen after 90 days. In 45 days, we could not see but it did not deteriorate. It was maintained. So probably it takes more time to increase the testosterone levels. Now what next? Okay, we know that our product works. Our product are quality products. What next? What next is more research has to be done, keeping in mind the global burden of diabetes, whether it is India or whether it is Sri Lanka, we have to study these formulations in diabetic population. And these diabetic populations are also taking Western medicines. So first of all, we have to study the drug-drug interaction of these medicines. When we give our medications with Western medicines, is there any drug-drug interaction? This is what we have to study. And as said earlier, we are working on the mode of action of our products. For example, how does Bij Pushti Ras improve spermatogenesis? So does it activate the mTOR pathway? Or when we talk of Sheela Prong and Bij Pushti both, they improve the virility. So what is the mode of action? Do they work like tadalafil or sildenafil? So this is our future work which will be starting. And at general practitioners level, in your clinic also you can document it. Your single cases, 2 cases, 3 cases, whether it is semen analysis before and after treatment, or this PDT score or IAF 15 are easily downloadable, you can use it. Thank you. And I would like to thank our director, Ranjit Puranik sir, for giving me this opportunity. Thank you.
Thank you, Dr. Mukesh Chowda. And I would like to invite our co-chair today, Professor Molly Goda, to present a token of appreciation to Dr. Chowda on behalf of his presentation. And we are honored to have you here today, Doctor, to have an important topic being discussed with the male reproductive health with Ayurvedic interventions. And now, our guest speaker today, Dr. W.A.S. Saroja Pirakun, who is Senior Lecturer in Ayurveda Pediatrics at the Faculty of Indigenous Medicine, University of Colombo, and an Ayurvedic Consultant Pediatrician at the National Ayurveda Teaching Hospital, Colombo. With over 16 years of academic experience and clinical experience, she has trained undergraduate and postgraduate scholars in Ayurveda. She has also holds a PhD in medical sciences and has contributed to curriculum development, ethics committees, and mentoring programs. Her research focuses on pediatric neurological diseases and bioactivities of indigenous medicines. Dr. Virakun will today present effective use of Rasaushadhi in Balaroga. Over to you, madam.
Can I use that one?
Sorry?
I can use this one also.
You're using this one? Or this one?
I will use
All
this. Respected chairperson and co-chairperson, and also distinguished guests, honorable speakers, and invited parties, and my dear students. Today I would like to discuss about the effective use of Rasaushadhi in Balaroga. So according to the Ayurveda contents, so I would like to just give an idea, because there are some special field, pediatrics. Yes, as you know that Rasaushadhi is a branch of Ayurveda and that deal with preparation metals and minerals which are called Rasaushadhis. And just we have an idea about the Rasaushadhi. It's just not a Parada, but other ingredients. You know that Maharasa, Uparasa, Sadharan Rasa, all are ingredients included our rasa preparations. So other than that, you know that gold, silver, iron, copper, tin, likewise. There are, and other than the bell metals, also usually used for the preparation of drugs. In addition to that normally metal, salt and other substances such as coral and also seashells, feathers also used for the drugs. Because when we are discussing the pediatric cases, we have to think about these ingredients because we are usually work with small kids. So normally it is play an important role in Ayurveda Chikitsa. Not only that Rasaushadhi especially mentioned in Ayurveda indigenous medical sector as well. Normally indigenous sector that in our Sri Lanka, that traditionally there are a lot of Rasaushadhis we are using here for the management of several disorders for the pediatric cases. As you all know, that Bala Roga, that it is included into the Kaumara Bhrutya. It also covered, you know, that Kaumara Bhrutya, Nama Kumara, Bharana Dhatri, Shira Dosha. Likewise, we have to think all the coverage, especially Dhatri and also the Shira Dosha, because when we are dealing with the kids, we have to think those drugs also will be practiced in the Dhatri as well as the kids. Balena Nuna iti Bala. You know that the child has less strength and survive with the less energy. So other than that, Kutsino Maro Atsyati. We have to think that baby is easy to die. So therefore, we have to have an idea how we should work with the kids when we are treating. It's very responsible work as a doctors because they are in the vulnerable age group. And these are the significance, Vishishtata mentioned in Ayurveda when we are treating the kids using Rasaushadhi. And pediatrician, not only the pediatrician, but also all the doctors should be more proficient in the recognizing pathologies and their observation to initiate treatments, as the nature and the dosage of medicine depend on the gravity and the severity of the diseases. Because it should be, we can't identify, we have to identify the cases and their pathologies very well before we start the kids' treatments. Because if not, it will be harm to the kids. We have to identify their signs, symptoms, and we have to identify their dosha conditions when we are treating. We cannot afford to make mistakes as the child is very delicate. Because you all know, our children are our lives. So we can't do any mistake when we are treating the kids. Therefore, we should take all the responsibility when we are treating the kids. The role of the doctors is always critical, as he or she must look after the state of the artery's health for the welfare of the child and when treating the child. You know that normally, especially we are thinking about the Navachata period, it's a neonatal period, and Shirakalina period, Shirapa period up to 1 year, and up to 2 years, Shiranad. Definitely we have to think about the Dhatri's condition, because if some diseases can be associated with the Shira dosha, therefore we don't need to treat only for the kids, but we have to treat the, especially Dhatri, feeding mother as well. Most of the cases come in search of our Ayurveda treatments. They have a lot of problems because of the pregnancy associated issues. It's mean natal period associated and prenatal period associated condition. as the Professor Sujata Madam said, it's very important when we are treating the kids, it may be, we are thinking about the welfare of the kids, we have to think about the pregnant period as well and Dhatri period as well. When we are consuming the Rasaushadhi, think about the Kapha Ketu Rasa, Guti-Vati, we can't address those drugs. It has mentioned as a contraindications to kids as well as Dhatri and also the Garbini. So, other than that, in Balavastha, these are one of the important points. We should think about the dosha, dhatu and malas. They are specialties less in quantity. So we don't want to, we can't compare with the adults because we have to think according to the age-wise bias and other conditions, especially thinking about balas, age, dosha and conditions. And sometimes in our setup in Sri Lanka, the majority of pediatric diseases can be managed with samana aushadha. It means sometimes we don't need to think about the shodhana karma, we don't think about the tikshna aushadha. We can manage these things using herbal products as well as mineral products. Even drugs with mudhu and madhyavirya, it's also very effectively work with children because they are attributed their mudukayata and alpavirata. Therefore, we don't want to think about very high doses and high properties about the drugs because sometimes some kids also we can manage with our words as well. Sometimes most of the kids come in search of our treatments, especially for mental disorders, because of the less of affection their parents. At the same time, so we have to think my parents come in search that they inform us babies having lot of diseases because of their attention. So we have to think about their care and also we can manage those things with our words. And also the drugs given to the child must be of low potency, small dose as well as less frequent administration. Also depending on the various factors like dosha, agni, bala, vayas, vyadhi, koshta, prakriti. Sometimes other than those things we have to think about the baby's body weight, especially growth and development. We have to think other than those criteria. Sometimes some babies, as we think about the babies in age of 4 years, they should have around 16 kilos, but they are in around 12 kilos. So they are in the crucial condition according to the Ayurved. So we have to think about the dosage and other drug also variations we have to think when we are using the herbal drugs as well as mineral drugs too. And most of Rasaushadhis are tikshna and ushna. Hence they are first acting even with the smaller dose, also are palatable and easily absorbable. And when we are thinking about the kids, especially associated with Pitta Doshita condition as well as Rakta Doshita condition, so we should think because they may be the Tikshna and Ushna, it may increase their condition. If not, we have experience, we don't need to worry about the Tikshna Ushna properties. We are using most of the rasa drugs with Anupana as previous speakers also said. So we have to think about the Pit Shamana, Tikshna Shamana, Anupana when we are using rasa drugs, especially for kids. Other than that, each Rasaushadhis mentioned in the Samhita is advised to be administered with Anupana, which helps proper assimilation and absorption. In here, normally, we have found several authentics that they are usually use Anupana, breast milk and ghee and madhu, especially for the pediatric cases. Kashyapa Samhita also identified as these are important for the management of other untoward effects associated with medicine. And also you know that madhu is also have synergistic effect, and it is effectively we can it is Yogavahi properties will stimulate the assimilation and well absorption of the drugs. And other than that, Kashyapa Samhita, it has mentioned that medications to be given to the children should be heard. It is also with the rasa drugs associations. Therefore, these are the key factors. Rasaushadhi administration in children, so we should think about the proper dose, because proper dose means that you know that Beshadan Salva Matrantu Yata Vyadi Project, because drug administration to child should be proportionate to the small quantity, because they can't express their activities, mention their problems when they get any other side effects, because they can't express their other than crying. So time, mode of drug administration, and diet and routine management, shelf life, testing and analysis of the drugs before use is important, but main thing is we have not enough facility to do the testing and analysis part when we are using drugs. But it is the most important thing. We have to do all the analysis parts when we are using not only the rasa drugs but also the other drugs for the pediatric preparations. These are the role of specific metal used in Rasaushadhis towards pediatric care. As you all know that Swarna Prashana, it's one of the most important Kalpana mentioned in Jata Karma Sanskara. So Acharya Kashyapa, it has clearly mentioned crude swarna should be taken and rubbed on the stone along with madhu and ghee are given to the child for licking. So it is our concept. We are also, I know that in the Indian culture, they are usually use these things in their heritage. And using 1 month, child become intelligent, free from diseases. And using 6 months continuously, the child will be able to retain. It is indirectly mentioned with the Acharya Kashyapa. If we can use this Swarna Bhasma without continuously, it will not be affect to the kids. It's it's safe. So it is we don't need to do any research regarding to that Swarna Bhasma, because it is already indirectly mentioned. It is continuously we can give those things. And other than that, application of Swarna Prashana as guided by the Kashyapa Samhita, and also they have mentioned that their children administration to the children on specific days according to their systematic and holistic approach with Pushya Nakshastra. So it is one of the most important part. We are not here practicing those things. That is one of the important point we have to address. We are planning under our department. We are thinking how we are using those things in Sri Lankan kids. And this is the dosage when they are mentioned in our authentics. We can use those things as well in Sri Lanka. It has mentioned that before 0 to 2, it means birth to 2 months. If we use daily dose, Swarna Bindu Prashana should be given for minimum 1 month to maximum 6 months. So that is why it is indirectly mentioned as well that there is no any toxics, so we can give it on daily basis up to 6 months. If not, that it has we have already learned, I think, our students, they are thinking, they already think that they will only use as a Jata Karma, but in India, in our Ayurveda setups, they have mentioned we can give up to 16 years of age, up to. So, according to that, dosage are mentioned here, for above 5 years, kids, we can use 4 drops up to 6 months continuously for improve their immunity. Not only that, monthly once for a minimum 30 months to maximum 90 months to day of Pusha Nakshastra Day. It means that sometimes if we can at least introduce those things in Sri Lankan setup, it means 90 months means around 7 years. So if they are usually use those things above 5 years, only one day, daily, it's 1 day basis treatments, as we can use those things for the improve our kids' health. These are the Pusha Nakshastra dates for Sannaprashana for the 2025 year. So every year they are preparing that kind of calendar and they are practice those Pusha Nakshastra day involvements that there are kids, Indian kids also having these Sannaprashana, Sannabindu Sanskara. So if it is important for the immunity system towards disease become stronger. Therefore, we are having a lot of issues. If we can introduce those things in our country, because of the previous economic issues that we have to face a lot of economic issues, therefore already identified as Sri Lankan kids having acute malnutrition conditions. So other than that, most of the kids come in search of our treatments in our hospital. They are having especially mental developmental issues such as autistic disorder and attention deficit hyperactivity disorder, mental developmental delay, behavioral disorders and learning disabilities. Not only that, brain damage, it means associated with cerebral palsy conditions also there. So this is the prevalence of these conditions are very high in our setup. If we can introduce those type of program for our kids, it will very effectively effect will be for the Sri Lankan kids as well. Normally, I think here most of the community medical officers also there, they know, I think they have already usually used that awareness programs in Sri Lankan children. Up to 5 years, most of them having nutritionally problems. In several areas, most of the doctors call and ask get some ideas related to their malnutrition condition. Because of our, especially our kids usually use of junk foods. Other than that, our Ahara Viharana, not only the Viharana, Ahara, but also the Viharana, they are usually addicted. They are Asatma Indriyartha Sangyoga, they are. Normally our screen addictions is the most important cause for the condition of Mano Daurbalya. So our kids are now usually eat data. They are looked after by the, their screen will be looked after by our kids. That is the most effective problem in our kids. So therefore, we have to address those things as well as we have to give that message to the parents while we are treating the kids. If we introduce Sannaprashana, increase in physical strength and growth of baby, it is also important for the growth. And grasping power analysis power, and recall memory. Most of the kids come in search of our treatment asking for their memory lost. Because parents are asking those things. I have an experience. One kid came with her mother. I asked from that kid, "Puta, ai aave oya?" Doctor, auntie mata buddhi adoi. It is not good word to hear that mama ho kawuda puthe kiyanne. Then he told ammat kiyanawa teacher kiyanawa. That is the main problem associated with our kids, that we have to give their power, we have to give safe guard with parental supports. Normally in Ayurveda setup, it's clearly mentioned how we should do with the support of our parental care. And also improve the skin color and texture, protects the child from different kinds of allergies. Recurrent infections are also increased by day by day in our kids. So therefore we have to give some immunity boost. Other than Ratakalka, Desundunkalka in Sri Lanka, we are giving another Urabhet. But if you can introduce this Swarnaprashana Sanskara in Sri Lanka, it will definitely affect to our kids. Acharya Shushruta has described 4 recipes. We are using those recipes to management we didn't do any research using the kids, but we are usually use that case studies using that kind of recipes. It has mentioned that Swarna Bhasma with Kushta Vacha, honey and grit. All the recipes including Swarna Bhasma and also Meda Vardhana drugs included, Vacha, Brahmi likewise. All the ingredients has mentioned as honey and ghee as anupana for the management of these as anupana for these drugs. So this is important for the growth and brain functions for the kids. So we can, as doctors, you can prescribe those things to the kids. It is important for because we have found a lot of experience with case-based findings when we are using Swarna Bhasma for their mental development. And also Acharya Vakbhatta also mentioned combination of Vacha and Saraswata Grita with Swarna Bhasma. It is very effectively manage the mental development disorders such as autistic condition. These are the research findings related to the Swarna Bhasma. Swarna Bhasma process immunomodulatory, free radical scavenging activity, analgesic, antihistaminic activity, and it is also safe. It is toxicity also safe, so we don't worry about the rasa drugs, so we can continuously give those things to kids as Acharya Kashyapa mentioned. And also research studies state that Swarna Bhasma mixed with Grita and Madhu was given to children, and after 6 months there was increased the mean level of immunoglobulin. It means IgG, IgA and IgM. It is also important. It is work as the immunomodulatory effect. And also assessment of liver function test. It is, and also histological studies, it's revealed that there is no any toxic effect for the long-term administration. It means we can use those drugs as mentioned in Charaka, and also I read the authentics. Swarna Bhasma has been proven to exert antioxidant, anti-depression, anti-cancer and antibacterial as well as anti-rheumatoid properties. So if you can arrange the researches. We have already thinking about the research with the kids. Most of the kids having leukemic condition in Sri Lanka. It is somewhat, prevalence is somewhat high. So with the support of the Western doctors, also we are planning to do the Sanna Prashana Sanskara with check the effective activities related to the anti-cancer effects. And also common use of Rasaushadhis for children. It is usually not only the, I have mentioned, not only the Ayurveda, but in Ayurveda traditional medical system, it clearly mentioned there are several recipes used for Rasaushadhi for the management of childhood disorders. You know that Vatika Prakarani, it's the one of the most important book mentioned, authentic book mentioned in Ayurveda, which especially use several drugs for the management of pediatric disorders, other than Jivaka Kalka, Buddharaja Kalka, Balakumara Valmi Kalka, Yashti Kalka, those ingredients, those recipes also usually used for the management of our pediatric disorders. In Buddharaja Kalka, there are several rasa ingredients included. So therefore, we advise to doctors and we teach to students better to use those Buddharaja Kalka after over 5 years kids. Other than that, other drugs, Jivaka Kalka, Balakumara Kalka likewise. Other than that, there are several Vati, Shankavati, Mutunche Vati, Sitarama Vati, Haritakadi Vati, Swasakutara Vati. We can use Shira and Kala kids as well, because they are, if the baby is over 1 year, we are using those drugs for management of several disorders. These are the research review on Rasaushadhi use in children that conducted by undergraduate, under my supervision undergraduate student. So we, at the moment we are using those drugs in Ayurveda National Hospital for the management of the childhood disorders. We can use these drugs after 1 year according to the traditional concepts. And also use of, these are the other drugs, Lahua Bhasma, Shanka Bhasma, Vajrashara, also we can use for the treat the kids' disorders as adults, that all the indications are the same as adults, but we can use that those things for kids also. Use of Rasaushadhi, especially, usually use Rasaushadhis in our setups in Ayurveda traditional system, in our hospital-based treatments. Chandra Prabhavati, Sri Mutunche Vati, Ramabana, Shanka Bhasma, Somanatha Rasa, and Swasakutar Rasa, Arogya Vardhana Vati, Kola Daunde Vati. They are effectively used in management of childhood disorders, especially Kola Daunde Vati. At present also we are usually use mental disorders, likewise ADHD, attention deficit hyperactivity disorders, as well as Vata Roga diseases, and other than that, especially for management of childhood associated fits conversion. It is effectively used in our setup. Usually we can use one pill for morning and evening for management of fits for the kids. Other than that, normally Swasakutara Rasa, also we are usually use drug for the management of asthmatic condition over 1 year kids. Chandraprabha Vati also we have used for this, specially associated with Kumari Rachomati age associated disorders. So it is also mentioned, other than those things, Mutra Roga, Tridoshakna, Pandu, Kamala, likewise, we can use those things for the management of adult pediatric cases. And also we are usually use the Mandura Bhasma. It is also help to boost Rasadhatu and cure anemia in children. These are the drugs we are usually use GIT associated disorders, Lakshmi Vilasa Rasa and Loha-Parpati and Mudga Rasa, Godanti Bhasma, Danti Lahu and Gudushi Mandura. They are important for the enhancement of anemic condition, will recover from using that kind of drugs. It is Lakshmi Vilasa Rasa also we are usually advised to take that jaundice associated with anemia, and also Swasakasa Chintamani Rasa also described for the management of bronchial asthma conditions, and Rasa Parpati is usually for infants, cause cough, cold, fever and indigestion. It is for Shirapakala period also we can use that kind of drugs. These are the important part that when we are using rasa drugs, we have to think about their dosage, especially when we are usually use that babies in Shira period, it's been up to 1 year, that dosage will be in 15 milligram. It will continue up to 250 milligram when the baby is in age of 16 years. And Avaleha, Kalka and Choorna also usually use these drugs according to the mentioned dosage. Not only that, we are usually add those drugs, especially internal drugs and external application. Other than that, our Rasaushadhi, especially used for the management of mental disorders, Graha Roga and Unmada Roga. So it is mentioned in Daiva Vyapasha Chikitsa, especially Bali offerings and Manibandhana, Manidharana and home japa. Likewise, we are use those things Rasaushadhi for the management of Graha dosa. In Sri Lankan setup, we haven't lot of prepared drugs other than that traditional medicines that Lakshmi Vilas, we are usually use that kind of drugs for the management, and also we have challenges when we are using those drugs. To long-term use of metallic and herbal minerals preparation it is safe. It has mentioned safe, according to the authentics also safe, but we have to give those drugs with the guidance of the qualified Ayurvedic physicians. And also we need to conduct studies to check their safety and efficacy. Their manufacturing process is also time consuming, so it is one of the challenge we have to face. And any shortcuts method rasa drugs preparation can be risky, unsafe or ineffective. So we can't use any shortcuts for the drug preparation. According to you can check our Ayurveda pharmacopoeia clearly mentioned. Think about as example, we can use that Kalka, Buddharaja Kalka, it has clearly mentioned there are around 7 or 8 rasa ingredients in Buddharaja Kalka. It has clearly mentioned each ingredients, likewise how to do the Chodana and Marana preparations when we are using that drug. Therefore, we can't use any shortcut method for the drug preparation, especially when we are using those drugs for the kids. Therefore, proper care should be taken during the Shodhana, Marana and Amrutikarana process of these metals and minerals. We have witnessed an effectiveness of Rasaushadhis in our setup, our hospital setups. We are using those things for the practical basis. So we have witnessed to their effectiveness, so we can continue those Rasaushadhi, but we have challenge. We should do the research with the support of the other setup. So if we can do those things with the support of medical sector, Ayurveda and Western also together, we can do the research-based activities for to show the effectiveness and also study the safety effects. And you all know, children are our lives. As doctors, we must take responsibility when treating pediatric patients, just as we treat our own children, because no other gift that Charakacharya clearly mentioned, no other gift it is greater than life. The patient may doubt his relatives, his sons, and even his parents, but he has full faith in his physician. He gives himself up in the doctor's hand. As same as parents, they come in search of your treatments because they believe their kids will safe in your hand. Therefore, we should very carefully handle the kids when we are treating. So, thank you very much. I would like to thank for Dutapapeshwara company and organizing committee members for inviting me as a speaker for the 8th edition of Rasashastra Sambhasha. Thank you.
Thank you, Madam. Thank you, Dr. Saroja Virukon. And we would like you to accept the token of appreciation presented by one of the co-chairs today, Dr. Karunaratna. Dr. Karunaratna will present the token of appreciation on behalf of Sri Dutapapeshwar Limited and the organizing committee for being one of the prestigious speakers today at the 8th edition of Rasashastra Sambhasha. And now we move into the next guest speaker today, Dr. Pradnya Aptekar, a renowned Ayurveda gynecologist and gold medalist from University of Pune, brings over 2 decades of clinical and academic excellence. She integrates classical Ayurveda with advanced techniques like IVF and laparoscopy. She has held key academic and advisory roles, including at NABH and AIIA. Her research on Ayurvedic management of conditions like PCOS, infertility, is widely published and recognized internationally. Dr. Aptekar will share her expertise and valuable insights on the intricacies of Rasaushadhi use in gynecology today. Over to you, ma'am.
Hello everyone, Namaste. A very good afternoon, or rather good evening to you all. Respected Chair and Co-Chairpersons, and respected Dr. Sujata Madam and other dignitaries on the dais and off the dais. First of all, I would like to express my sincere thanks towards Sri Dutapapeshwar Company for giving me this opportunity to share my experiences, rather clinical experiences, in front of such a learned audience and the inquisitive students. Additionally, I really appreciate the warm hospitality of people of Colombo and of course the organizer Sri Dhutapapeshwar Company. So coming to the presentation, today I will speak on the intricacies of Rasaushadhis used in gynecology. So as you know, the intricacies means the elaboration of complex things. So I will try to simplify the complex details of Rasaushadhis in gynecology in the aspects of how, when and why. So let us start. So to know any Ayurvedic formulation or any medical formulation, we need to understand the concept of pharmacokinetics and pharmacodynamics. Pharmacokinetics describes the body's effect on a drug. The processes includes absorption, distribution, metabolism and excretion. And the pharmacodynamics refers to the drug's effect on the body. So it involves studying biochemical and physiological drug effects. Together they explain the drug journey, the travel process of drug throughout the body and the actions in the body. So in short, in the pictorial manner, so pharmacokinetics is ADME, that is absorption, distribution, metabolism and excretion. Ayurveda talks about all the four things. So we are discussing all these processes in a Ayurvedic manner. So for the clinicians, grasping pharmacokinetics and dynamics is essential in establishing the correct dosage regimens for different medications. So variations in absorption rates, metabolic pathways and patient-specific factors like age, organ function and genetic differences can significantly affect or impact both the efficacies and safety of the drugs. Likewise, in Ayurved we say, before giving the medication you have to consider 13 factors. Dushyam, Desham, Balam, Kalam, Analam, Prakrutim, Vayaha, Sattvam, Sattvam, Tathascha, Avasthascha, Prutagvidaha. So likewise we have to think about all the avasthas of the patients. Then coming to my topic, that is the Artava Srotas, the gynecological reproductive system. So if we think about the Artava Srotas in Ayurvedic manner, so we have to think about the Ayurvedic Sharira Rachana and Ayurvedic Sharira Kriya, so that we can understand the pharmacokinetics of the Ayurvedic formulations. So if we consider Artava Srotasa, so dhatus which are responsible for this are Rasa, Rakta, Mausa, Meda and Stri Shukra. And if we consider Upadhatus, Navina Raja, that is the proliferative phase, then Artava, that is the ovum, Stanya, Sira and Snayu. Then Mala, if we consider Mala, then the Purana Rupa Raja, that is the luteal phase or the menstrual blood. Then Kesha and Loma, and Srotosas which are involved in the physiology of Artava Srotasa. Only one Srotas is not acting in the body. At a time, all the Srotasas, Samayoga Vahi, our body is Samayoga Vahi. So every one Srotasa has impact on other Srotasas. So the Srotasa involved for the physiology of Artava Srotasa are Rasavaha, Raktavaha, Medavaha and Shukravaha. So just we will have a rapid revision for everyone. So it's a flow chart of Raja Utpatti and Raja Nishkraman. So that is the menstrual cycle. So when anyone consumes ahara, that is, then there is the action of Jatharagni and Samana Vayu on ahara. That is get converted into ahara rasa. Again there is the action of Vyana Vayu and Samana Vayu and Rasa Dhattvagni on ahara rasa leads to Artava and Raja Utpatti, that is the Navina Raja Utpatti again. With the help of Rajavaha Sira, there is a Raja Sanchiti, and with the action of Apana Vayu, the Raja Nishkramana happens, that is the menstrual cycle. So whenever patient comes to you for the PCOD-like conditions, you have to customize or construct the pathway of each and every patient so we can get the actual avastha of the patient. So where she is lacking in the ahara, then we have to treat the ahara. Where she is lacking in the rasagni mandya, then we have to treat the rasagni mandya. If she is having the apana dushti, then we have to treat the apana dushti. So likewise, we have to treat. So next, so in short, if we see the menstrual cycle as a whole or the Rutu Chakra as a whole, so period, the Rajak Kal means the menstrual period, Rutu Kal means the fertile. Likewise, you can see in the my slide. So the main thing is the dominance of dosha during the Rutu Chakra is important, that the Rajak Kal is Vata Pradhan, Rutu Kal is Kapha Pradhan. Again, Rutu Kal has the two phases, proliferative phase and the luteal phase. So proliferative phase is Kapha Pradhana Pittanubandhi and the luteal phase is the Pitta Pradhana Kaphanubandhi. And at the time of ovulation, absolutely it is a Pitta Pradhan, Artavam, Agneyam. So we know that. Then Ruta Vyatita Kala, Purana Rupa Raja, that is the Pitta Pradhan again. Then characteristic, if we see, the Raja is Vala Rupa and fertile period, again Dhatu Rupa, Artava Utpatti, that is a Dhatu Rupa, and Upadhatu Rupa is a Navina Raja, and Purana Raja is the Malarupa Raja. That is not Upadhatu. There is a difference between Upadhatu Rupa Raja and Malarupa Raja. Upadhatu Rupa Raja is the fertile endometrium, and Malarupa Raja, it is not fertile, it is just discarded as a Malarupa. So those references are from the classical Ayurvedic Samhitas. So in short, if we see the Ayurvedic Sharira of Travarta Yoni, that is Artava Srotas, it is the Upastha Karmendriya and under the influence of Pranavayu, and again it is a part of vital organ, that is the Marma. So again it is controlled by the Pranavayu. So we can get the understanding of HPO axis here. So HPO axis is again controlled by the Pranavayu. Then the Sangatanatmak, that is the construction of uterus, it is by Snayu Peshi Pradhana, that is the muscular organ. So it is Rakta and Mausa Dhatu Pradhana. Then Rajovaha Siras are involved. So as Siras are the Upadhatu of Meda Dhatu, so Rakta and Meda Dhatus are involved. Antaphala, that means the ovaries, which are again, these are included in the Dasha Pranayatanani, that is a part of Pranayatana, and Shukrava Srotasa Mula Sthana. So Antaphala, again ovaries are also under the control of Pranavayu. That's why again the HPO axis, you can understand again the, we have to, when we are treating the PCOD conditions, we have to treat the HPO axis again. Then when we see the fundamental elements from which the Garbhashaya or the Travarta Yoni is constructed, then it is again the Prithvi and Apa Mahabhuta Pradhan. Snigdha Guna Pradhan, Mrudu and Shlakshana, those are the essential qualities required in the Travarta Yoni for the Garbha Dharana. If anything quality, if it is reduced, then infertility can happen. Then uterine cavity, then it is Akasha Guna Pradhana, and it is again the control of Vata, and it is a Matruja Aveva by genetic. If we see the inheredity or the likewise, so it is a Matruja Aveva. So hence, in clinical practice, we need the family history of maternal side more, like sister, maternal mother, or maternal auntie, likewise. There is one unique reference. So if we see the embryology, so embryology of urogenital system, it happens at the 9th week of gestation. So it's a different reference I want to quote here. The urogenital sinus is described as a shared passage where the both urinary and genital tracts converge. So the common urogenital sinus represents a typical phase in embryonic development for both the genders. Again, we will get the importance of this reference in further slides. In typical females, the development of Mullerian ducts halts around 9th week of gestation and resulting in a urovaginal confluence or common urogenital sinus. If it doesn't happen, it can lead to congenital Mullerian defects. So whenever congenital anomalies are formed in the urogenital system, that happens at the 9th week, up to 9th week of gestation. And the another thing important for to see the pharmacokinetics of kalpas, the embryological development of urogenital system which arises from the intermediate mesoderm. So both the system are formed from the mesoderm. Hence, there are many Ayurvedic formulations, both are used in urogenital disorders. So we will see it afterwards. So, formation of the urinary system from the nephrogenic cord and the formation of reproductive system from the gonadal ridge. So in both male and female, we see the urogenital system developed from the intermediate mesoderm. That's why many Ayurvedic formulations act on urogenital system simultaneously. So that we can see in the further description. So this is the picture of formation of Shukra, Artava, Srotasa at the 9th week of gestation. You can see the undifferentiated gonad, and afterwards it is differentiated into male and female. And you can see the fallopian tubes and the duct formation, duct fusion, and the septal reabsorption. Whenever there is no septal reabsorption, then this is the congenital Mullerian defects, which is called as Sahaja Vikruti, which is asadhya. So now there are surgical interventions. We can treat the septum resection, septate uterus or the subseptate uterus with partial or complete with the surgical intervention. So now coming to my point, that is the pharmacokinetics of kalpa. So to understand any kalpa, we have to think about Mahabhautik Sangatana, that is the fundamental elements which are used in the ingredients. Then Vyadhi Pratyanikatva, Rogadhikara, Roga Avastha, whether the Roga Avastha is Nava or Jirna, that is acute, subacute or chronic. Then Patha Bheda, I am going to talk on this. Patha Bheda, there are different formulations of one kalpa. So whenever we are seeing, talking about one kalpa, that Lakshmi Vilas is used, but of which patha, of which adhikara we are using that kalpa, it is important. Then kalpe pradhana dravyasya parimanam, means whenever we are seeing the ingredients of any formulation, the formulation may have some ingredients in bigger amount and some ingredients in smaller amounts. So that changes the pharmacokinetics. Then kalpa nirman vidhi, that is the process. Whether you are using as a Pottali, you are using as a Parpati, the same Kajjali is using in all the kalpas, but the process changes the action and the target sites. Then Bhavana Dravya, that is avarti, how many times you are giving the bhavana to that kalpa, that also has very much influence in that action. Then which part of vanaspati upayuktanga, which part of vanaspati you are using for the bhavana, that is also changes the route of action. Then that is the formation of kalpa. But when we are using the kalpa on the patients, then it can changes its action with the matra bheda. That is, you can alter the dosage, you can see the change in the action. For example, just for students I am explaining this. If you take Avala Choorna, Emlica offensilis, Choorna, 1 gram, that will give you effect of Pitta Shamana. But when you are taking this Avala Choorna in the dosage of 5 grams or 10 grams, you can get the effect of Virechana. So Matra Bheda affects the action of Kalpa. Then Anupana Bheda, that I am explaining in later in detail. So when you change the Anupana, the Gamitva or the action of Kalpa changes. Then Aushadha Sevana Kala. Vagbhata explains the 13 Aushadha Sevana Kala. Apana Kala, Vyanodana Kala, Muhurmuhu, Prana Kala, Grasantara, etc. So before food, after food, in between the food, Samana Kala, Apana Kala. So what kind of medicine you are using at what time, that is also important. Then Aushadha Kalpana, Swarasadi, there are Panchavidha Kashaya Kalpana explained in Charak Samhita. So when you are using Tulsi Swarasa, its action is different. When you are using Tulsi Kwatha, its action is different. And you are using Tulsi Ghanavati, the action is different. So likewise, we have to think about the kalpa, ki what kind of kalpa we are using. Then Aushadha Prayoga Vidhi also has the different actions. Like Abhyantara Sevana, orally. Then if you are using the Taila or Gruta Kalpana, orally the dosage and everything is different. But if you are using the Gruta Taila Kalpana in Basti and Uttar Basti or Nasya Vidhi, the action is totally different. So likewise, so now you can got the overall idea of the kalpa. When we are using kalpa in clinical practice, we have to think about all the factors before using that. So for example, in today's lecture, I will explain one kalpa in detail so that you can understand how we can think about the kalpa, and afterwards you can easily understand other kalpas. So I am explaining from, I think from the starting, we have discussed Prameha or Madhumeha. Dr. Mukesh sir already explained the prevalence of Prameha in Sri Lanka also. So I think this will help you to understand the Prameha and the gynecological disorders in resemblance with the PCOD and other conditions. So if we see the Samprapti, in Charak Samhita, we get the Samprapti. The primary pathology, the Pradhan Vikruta dosha are the Kapha, Vata and Pitta. All three doshas are involved. Still the Pradhan dosha is a Kapha. Kapha is the Pradhan dosha in the Prameha. Then Pradhan Vikruta dhatu are Mausa and Meda. But after, as the disease progresses, that is the Samprapti becomes Nibida, the Samprapti progresses, the pathophysiology progresses, the Doshagati goes towards the another dhatus, Rakta, Shukra or Shonita, Shukra in male and Shonita in female, Ambu, Vasa, Lasika, Majja, Rasa, Rasa dhatu, and Upper Oja, and Mausa and Meda. So total there are 10 dhatus involved in the Samprapti of Prameha. So now look at the picture. This is the longitudinal section of Travarta Yoni. So we are considering Yoni, Travarta Yoni as a marma because it is situated in between the two Sadhya Pranahara marmas. That is anteriorly it is a urinary bladder, that is the Basti, again a Sadhya Pranahara marma. And posteriorly there is rectum, that is Guda, again Sadhya Pranahara marma. And also there is a reference of Antaphala, already we discussed in earlier slides, that is the part of Pranayatana. So, Travarta Yoni is a part of Madhyama Marga, and any diseases progress in these Artava Srotas become Dushchikitsya, that is Kashta Sadhya, difficult to treat because of this position. So, whenever Dosha Gati is there, you have, I think, all of you are aware of the concept of Shat Kriya Kala. So, there is a Samanya Samprapti, when there is a Shat Kriya Kala, the Dosha Gati travels towards another dhatus or many organs. So, similarly, if we see, I have quoted here two references, the Pittavrita Apana. In Pittavrita Apana, we get the Rajovruddhi, that is the menorrhagia. In this condition, we have the Dosha Gati in the Travarta Yoni. And in Kafavrita Apana, Kafa Mehasya Chagamaha. So if we divide these Sampraptis and try to understand, so we can see the two processes here. So what are the two processes? The Sthana Saushraya, the pressure of Kapha Pradhana doshas towards the Sthana Vaigunya. If the Sthana Vaigunya is in the Basti, then Sthana Saushraya will be the Basti. Then Kapha doshas will travel towards the Basti, and Bastistha Kleda Dushti will lead to Kapha Pradhana Prameha. Both are, urogenital system is in the Apana Kshetra. So if the Dushti is in the Basti, that will lead to Prameha. If the Dushti is in the Travarta Yoni, then the Dosha Gati will be leads to Travarta Yoni, and Travarta Yonistha Kleda Dushti leads to Kapha Pradhana Stri Roga. So I will talking about the Kapha Pradhana Stri Roga right now. Okay. So again we will have the Samanya Samprapti and the Bhinna Samprapti. If we see the Samanya Samprapti, the systemic visheshan of the doshas leads to, and in addition to systemic visheshan dosha, there is another point, that is the Hetu Sevana in Stri Vishishta Avasthas. So which are the Stri Vishishta Avasthas? Stri Vishishta means woman specific stages. Those are menstrual phase, pregnancy, puerperal phase, and menopausal phase. So during that active phase, because all these are the active phases of Travarta Yoni. In four phases, the reproductive system is under the continuous action. So during that action, if the woman has Hetu Sevan in Kapha Pradhan Hetu Sevan, then prasara of doshas towards the Travarta Yoni. And then there is a Dosha Dushya Samurchana in Travarta Yoni, and the localized and systemic effects or symptoms are formed, we called as Yoni Roga or Yoni Vyapats. So for example, if the Kapha Pradhan doshas travel towards the Prathamavarta, that is vagina or the vaginal canal, that leads to Upapluta Yoni Vyapat, Shweta Pradara, Kaphaja Yoni Vyapat or Yoni Kandu, like Kapha Pradhan conditions. If it is travel towards the Dvitiya Varta, that is the cervix or the cervical canal, then it can lead to Garbhashya Mukhapaka, Shweta Pradara, Arsha, cervical polyps, or any cervical erosion like conditions, and Yoni Kandu. If it travels towards the Tritiya Varta, then we will get the Rajodushti, we will get the Granthila Artava, that is a Kapavatatmak Rajodushti, then Kafaja Rajovruddhi, Antaphala Granthi, ovarian cyst, we can find this in the Kafavrita Vyana. So any Kafaja conditions, we get the, or Kafavrita Vyana conditions, we get the Antaphala Granthi, Arbuda, fibroids, adenomyosis, like conditions. So we can have the pathology of the, we can construct samprapti or pathology of each and every patient. So now coming to this era again, so we can get some references in research articles which states the PCO and the diabetes risk. The PCOs coexist with various dysglycemic conditions. Healthy weight maintenance reduces diabetes 2 risk. Menopausal women and PCO require regular evaluations. Balanced diet and exercise are essentials for PCOS conditions. Another paper throw light on gestational diabetes mellitus and the PCOS. So higher incidence of complications in GDM group, high GDM incidences in PCOS patients, targeted measures needed to reduce GDM, increase pregnancy hormones, worsen insulin resistance. This is again important key feature, and aggravated risk of glucose metabolism disorders. Another paper shows some key points like urogenital infection and diabetes. So urogenital infections occur more in diabetic patients. Choice of anti-diabetic drug affects urogenital infection. Urogenital infections may complicate diabetes management, and proper management is essential for diabetic patients in case of urogenital infections. And this another last reference, we get the interplay between the diabetes mellitus and the menopause, the clinical implications. So if we see the transition of menopause brings about the metabolic modifications that increases the risk of developing diabetes mellitus, especially type 2. So this is largely due to menopause contributing to a greater likelihood upper body fat accumulation and rise in the insulin resistance. So we get the reference, direct reference in our Sushrut Samhita. Rajab prasekat narinam masi masi vishuddhati sarva shariram doshacha na pramayanti atastriyaha. So whenever the woman is having regular menstrual cycle, she is not likely to have diabetes mellitus, or she is not landed up into the diabetes mellitus. But that is the vice versa, or the in between the what we say, in between the reference or in between conclusion, we can say whenever the woman is having irregular menses, or she is not having proper menses, or more kind of 6 months amenorrhea, 1 year amenorrhea like in PCOS, she is likely to have diabetes. So that correlation and the direct reference we get in the our classical samhitas. So gynecological disorders and diabetes goes hand in hand, that you can say. So PCOD and diabetes, PCOD and GDM, frequent UTI and diabetes mellitus, frequent vaginal infections and diabetes mellitus, postmenopausal status and diabetes mellitus. Many times in clinical practice, postmenopausal patients comes to us for the vaginal itching. And if we taste their sugar level, they are the diabetics. So we have to treat diabetes as well as the postmenopausal condition. So coming to our kalpa again, it is the choice of drug or the broad spectrum Ayurvedic classical formulation, that is Chandraprabhavati. We can use only Chandraprabhavati in this condition, in all these conditions. So we can decode the Chandraprabha. Now we will go. So if we see the etymology of Chandraprabha, asya satatabhyasa chandrasiva prabha kantir bhavati iti Chandraprabha. Satat abhyasa, that itself indicates we can use for a longer period. So we can use this formulation for longer period as a rasayana also. So Chandrasya prabha means the skin tone like moonlight that you can have with the Chandraprabha. So we can get, you can read it. So there are many textual references of Chandraprabha. Though Chandraprabha is a broad spectrum Ayurvedic formulation, it is not mentioned in Bruhatrayi. It is not mentioned in Charak, Sushrut and Vagbhata. But they are mentioned in other Samhitas. Then there are some formulations devoid of Shilajatu and Guggulu. In certain versions, camphor, that is Karpura, is used. That's why if you remember my earlier slides, ingredients of Kalpa are more important and Pathabheda is more important. The combinations containing Kajjali are included in Rasakalpa. So there are 3 main references of formulations about Parada and Gandhaka, that is Kajjali is used, that is in Prameha, Vatarakta and Arsha. So when you want to use the Chandraprabha, then you have to use proper Chandraprabha then. So you have to read about what Pathabheda has used in formulating this Chandraprabha. It contains Shilajatu of quantity of 8 pala, Guggulu of 2 pala, and sugar or mishri of 4 pala. So there are some historical references. Initially it is explained in first mention of Chandraprabha-Vati is in the Vangasena Samhita, that is in the 12th century. So at least 1300 years we are using Chandraprabha. So what other evidence we need, sir? We are using for this for 1300 years. In Sharangdhar, then you can go just reading the Sharangdhar, Rasendra Sara Sangraha, Gada Nigraha, Yoga Ratnakar. There are multiple historical references of formulations of Chandraprabha-Vati. Then coming to the ingredients of Chandraprabha, these are again you can see in Meha Roga Adhikara, that is Prameha, Rasendra, in Harit Samhita it is there, Karpura is taken and Bhavana of Karihari Rasa, but it is devoid of Shilajatu. In this Pathabheda, Shilajatu is not added. Likewise, in Vatarakta and Arsha, Shilajatu, Guggulu and Mishri are there. In Prameha, Shilajatu, Karsha, Sharang. If we take the Patha of Sharangdhar Samhita and Bhaishajya Ratnavali, then Kapura, Shilajatu, Guggulu and Mishri all are added. Then likewise you can go, then it is mentioned in Kshudra Rega also. In Shudra Roga, in Bhaishajya Ratnavali, the Swarna Bhasma, Ropya Bhasma, Abrak Bhasma, all these Bhasmas are also used. Then in Kushtha, Atisara and Prameha, again different Pathabhedas are available. So if we see as a Kalpa as a whole, we have to understand the Rasavirya Vipaka Siddhanta of a Kalpa as a whole. So if we see, the Kalpa is in Katu Tikta Rasa Pradhana and Ushna or Anushna Kalpa, depending upon the ingredients. If the Kapura is more, then it is Anushna. If it is not, the Kalpa is not having the Kapura, then it is Ushna. Then Vipaka, Katu Vipaka, Tridosha Shamaka, Doshagnata, Lagu Ruksha, Tikshna and Sukshma and Yogavahi is the qualities of Chandraprabha. So, the key ingredients and properties, according to the key ingredients, the pharmacokinetics changes. So, main ingredients, if Shilajatu and Guggul, 32 parts each, both are Katu Rasa Vipaki, Sukshma Srotogami, both are having Yoga Vyahi property. Then, Mishreya, 16 parts, Tikta Katu Rasa and Ushna property. So it balances, not Ushna property, it balances the Ushna property of Shilajatu and Guggula. So Acharya Charaka used Chandraprabha in both male and female. So if we see then again main dravya parimanaha is Shilajatu. It is 32 parts. So we need the action of Shilajatu, that is more important in the action of Chandraprabha. So, Dravya effectively eliminates the obstructed Kafadi Dhatu, referred as Chedaka Dravya, examples like Shara, Maricha and Shilajatu. So, notably all 3 Dravyas are found in Chandraprabhavati. Hence, Shilajatu performs Chedana for both Kapha and Meda Dhatu, sharing similar characteristics with Kapha. Hence, this you can use in obesity. This you can understand. But if you are using the Chandraprabhavati of another part which is devoid of Chilajatu, then that will not useful in the obesity. So therefore, Chandraprabhavati is administered with appropriate Anupana and Patha, you can get remarkable results. And this Chandraprabhavati with Anupana Bheda, we can use in different Vyadhi conditions. So these are some examples you can use enormously with Yuktistu Yujja Yati Yujjite. According to your patient's samprapti, you can use any Anupana. So if you see Kapha Pradhana, Shukra Dosha, Kaphaja Shukra Dushti, or Kaphaja Artava Dushti, Dysmenorrhea, Artavruja, you can use Punarnamashtaka Kwatha. Pitta Pradhan Shukra Dosha, Artavruja, you can use Ushirasav, Chandanasava, Dhanya Kwatha. Kaphaja Upapluta Yonipapad, you can use Mahamanjishchadi Kwat. Somaroga, you can use Kushmanda Swarasa, Tandulodaka. Katishula, Yonikata Sama Vata, you can use Rasna Saptak with Chandraprabha. Then in Aticharna Yonivapat and Vyavayottar Dorbalya, you can combine the Chandraprabha with Vasanta Kusumakar Rasa, and you can use the Kushmanda Rasa as Anupana. You can use Suvarnaraj Vangeshwar and Chandraprabhaviti with cow milk for the Vyavayottar Dorbalya. Then in premenstrual symptoms, you can use again Punarnamashtaka Kwatha, there is a water retention. In postmenopausal recurrent UTI or urinary incontinence, you can use Dhanyak Jirak Kwatha, Gokshira Kwatha. In Anartava, in secondary amenorrhea, in PCOS conditions, you can use Apanakali, Chandraprabha with Ajmoda Kwatha. Then obesity with insulin resistance, you can use Laghumanjishchadi Kwatha from Charangdar Samhita along with the Chandraprabhavati. So likewise, you can use, and there is a, as I elaborated first, there are two types of Chandraprabha, devoid of Karpura and with Karpura. So if we use the Karpura, Sakarpura Chandraprabha, it has some additional benefits because Karpura has Madhura Tikta Laghu Shita Sugandhi, that is aromatic, and Lekhana and Vrishya properties. So it is, you can use in Puya Shukra, Kunapa Gandhi or the Pyometra like conditions, and Daurgandhi Shvetaswava, that is the Leukorrhea conditions, you can use the Karpura Yukta Chandraprabha. Then Prameha Purvarupa, in which you are coming across the patients who are having the bad odor sweat. Daurgandhya Janaka Sweda Pravartan, Ati Sweda Pravartan. The Karpura Yukta Chandraprabha has a best effects on it. So you can use that. Then Alasya, then Shita Priyata, sleepiness, Klama, Glani, in that conditions also, because it has the aromatic effect, you can use the Chandraprabha in that. Then Upadrava, Kandu, Kasa, Kushtha, in Dantaroga also there is a reference. One clinical effect I would like to share. If the patient is having toothache, especially with molars, you can just keep a Karpura Yukta Chandraprabha in the molar for half an hour. The pain subsides. So that is the effect of Karpura, again as a painkiller also. Then Balya Vrushya Rasayana, especially in the couples who wish to conceive. So after Panchakarma, as we get the etymology, the Satata Bhyasat. So after Panchakarma, you can give Chandraprabha as a Rasayana Vidhi, Vardhamana Rasayana Vidhi to the couples. And in the earlier slides, but I think I did not explain it clearly. The maximum dose of Chandraprabha is 1 karsha, that is 10 grams. So maximum you can give 10 grams in one day. So you can divide it. So in Rasayana Prayoga, you can use maximum matra also. So according to Agni Bala and other conditions of patients, you can use the matra. Then if we change the ingredients, so Shilajatu is Chedana Dravya, Vacha, Guggulu are Lekhana. They are help in reducing the size and density of Grantha and Arbuda. So if you are talking about the ovarian cyst and the fibroids, we can use Chandraprabha also. With Shilajatu and Guggul-Yukta, we can use it in the Apana-kala. Haridra, Musta, Tikshna, Loha Bhasma, Suvarna Vakshik Bhasma, all these are Rakta Prasadak. So we can use in fibroid generated menorrhagia patients who are having the symptoms of anemia also. So it is Loha is there, so it is we are providing some iron to the patient also. Then Triphala serves as Lekhana and Rasayana Dravya. Chandraprabhavati is beneficial for the conditions like Arbuda, Granthi, including PCOD, fibroids and ovarian cysts. Then Loha Bhasma is Tikta, Kashaya and Ruksha Rakta Prasadak, Balya Rasayana, which is beneficial for addressing weakness and anemia resulting from the heavy menstrual cycle. Musta Haridra, Daru Haridra, Ativisha and Shunti, all are Grahi and Kledagna, hence that Kalpa is beneficial for Leukorrhea also. So, if we see the pharmacodynamics, the Chandraprabhavati is beneficial for all conditions affecting all the three Roga Margas. So, Shakha, Marma, Asthi and Koshtha. And it is particularly effective on Manasavaha Srotas because of Karpura again. Then Medavaha Srotas, Shukravaha, Mutravaha and Artavaha Srotas. It is attributed to Dhatvagnivardak, Amapachak and Srotorodha Nashak. So it is Srotorod, it is, we can, the obstruction of the Srota, so we can treated with the Chandraprabha, and additionally it possesses the Rasayan qualities, and we can have the Vyadhi Punarbhav effect also with this Kalpa. If a patient is having Upapluta Yoni Vyapad or likewise recurrent UTI, so you can use Rasayana, Chandraprabhavati as a Rasayana after the Panchakarma. The another reference, I think you are well aware about the reverse pharmacology. So in this reverse pharmacology, the approach where the clinical experiences and observations, especially from traditional medicine system like Ayurveda, are used, the starting point of drug development and drug discovery. So it is a combination of traditional knowledge, experimental observations and the clinical experiences. That is the reverse pharmacology. So we can study to understand how they work, validate their safety and optimize their effectiveness. So, it is the best example of Stri Vyadhi Hara Rasa, in which the Sutika Bharan, which is the classical formulation, is used along with the all other herbal components. So, one paper is here, I think it is a ICMR trial of Stri Vyadhi Hara Ras of Dudh Papeshwar company. So it is a herbal component. It includes the Latakarans, Shatava, Karpasamula, Shunti, Maricha, Pippali, Lashuna, and all these are having processed with the Asana, Kwatha and Lashuna Swarasa, and the Kalpa has potential to restore the menstrual cyclicity, and it can overcome the insulin resistance and improve the fertility rate. So the main component is the Sutika Bharan, which is the herbo-mineral composition. Again, the Rasaushadhi. Then Stri Vyadhi Hara Ras, it can tackles with PCOS and related issues and contains the benefits of Sutika Bharan Ras. It addresses all the gynecological diseases and helps with the peripheral diseases, treat the conditions like PCOD. So again, I would say it is a broad spectrum gynecological Ayurvedic formulation. So again, it is a Vishesh Gamitva is Artavaha Srotas, Rasavaha Srotas, Raktavaha, Manasavaha and Medavaha. Garbhashay Shodhan, action is Garbhashay Shodhan, Balya and Dhatu Poshak. And Granthakto dose is half Ratti, that is 1 or 2 tablets, that is 250 or 500 milligrams once or twice a day. And Aushadha Kal, again 7 Kal is a Apan Kal, that is the before the food. So, I think I have elaborate Chandraprabhavati in much broader aspect. So we have the time limit. So accordingly, you can consider all the kalpas. I will just name it. You can go through it, all the ingredients, all the Pathabedas and Rogadhikaras, and you can study likewise. So you can get multiple avasthas and multiple anupanas. With the help of multiple anupanas, you can treat the patients in various conditions of gynecological disorders. Like Chandraprabha is broad spectrum Kaphavata Pradhan formulation. Chandrakala is for the Pitta Pradhan, same way. So you can study Chandrakala. So Mutra Kruchara, Prameha, Pradara, Amla Pitta, you can get the broader Falashruti here. So you can use Pradarantak Rasa, Raja Pravartani Vati, Bola Baddha Rasa, Bola Parpati, then the Pratap Lankeshwar Rasa. So these are mainly herbo mineral formulations we are using in our clinical practice for last many years and getting the good results. So I think I have elaborated much of the Ayurvedic formulations, and thank you once again organizers for giving me this opportunity, and the audience. Thank you audience for the patient listening. Thank you so much.
Thank you, dear Madam, Dr. Pradnya Aptika, for that inspirational talk on role of Rasaushadhi in the intricacies of Rasaushadhi in the use of gynecology. And we would like to present you a token of appreciation presented to you by our chair today, Dr. Professor Jayavardhana. Professor will present you with this appreciation from Sri Dutapapeshwar Limited. And I invite the next speaker today, Dr. W.A.P. Vikramanayaka, who is a consultant Ayurveda surgeon at the Department of Ayurved, Central Province, Sri Lanka. He holds an MS in Shalya from NIA Jaipur with a master's in Ayurveda hospital management. With vast clinical and teaching experience, he has contributed extensively to Ayurveda proctology and surgical practices. He is reputed researcher, resource person, and active member in national and international Ayurveda forums. He will present on the topic, Role of Rasaushadhi in Ayurveda Surgical Management. Over to you.
You can click on the tab. This one.
This one, no?
Yes.
Respected chairperson and co-chairs and my dear teachers and my colleagues and students. Thank you very much for giving opportunity to come to your forum. I am talking to my colleagues, Ayurveda doctors. You can see this company, Dutapapeshwara. They are, I think, more than 130 years, 50 years. So with ancient knowledge, with modern technology, how they are now render service for Rasashastra. That is one part of our Ayurveda. So we talk good manufacturing practices and good laboratory practices, good clinical practices, and agricultural, and documentation, and teaching and training, all are doing what for? It is for patient safety. So, clinical practice, good clinical practice and other practices, it is patient safety and it is valuable for the health service also. So, ancient knowledge and modern technology is valuable for Ayurveda sector. You all are BMS. MD's consultant also here. So, we are treating to ancient people or present people? What do you think? So, we are treating present people, no? Not ancient people. So, what do you think about surgery? I think critical point. Javardhan sir. Surgery is a problem. Audience asked me what is surgery, what you can do. It is essential for the Sri Lankan or Indian sector. What is the role of modern surgery, robotic surgery also going on? So how we are? What for Ayurveda surgery? 2 gynecology madams from India. No sir, madam. Would you need Ayurveda surgery? Would you think about surgeries need Ayurveda surgery? Definitely. Definitely, no? Yes. What about Sri Lankan sector? It is need or not? It is need. This is motto. This is I taken from my Guruji, Professor Hemant Kumar sir. He made this by AI. This is his aim, and what about us? Would you like to this? I don't know, one day we can or not. Right. Ayurveda surgery without surgical theatre, operation theatre, we can do or not? Susuta told us, Shalyagara, Pranitagara, Aturagara. And sterilization methods, operation theatre. Without Shalyagar, how to do Shalya surgery? It is very difficult. Dear madam, we haven't allopathy medicine, no? So, no antibiotic, no painkillers. How do you practice surgery? More restriction for us. Now, the company members and all ask surgery management with Rasaushadhi also. Surgery management, Rasaushadhi, we should do the surgery, no? Otherwise, we can't do the surgery, the Rasaushadhi. So, we need operation theatre. We need surgeon. Without those, we can't practice. This is my hospital, and this is Susuta. We are practicing Dhanvantari Sampradaya. We are practicing Dhanvantari Sampradaya, and our textbook is Susu Samhita. According to this, we are practice. Actually, we need to know about what is Ayurveda surgery first, before using Rasaushadhi. So I am going to talk little about Ayurveda surgery. I know your condition now. Several lectures, several speakers done. Now you are suffering. Okay, only give me 5-10 minutes. I think organizers told me only 20 minutes. I will go. Okay, right. This is the definition of surgery. Shalyatantra Nama. Susuta described what is foreign body. Today bullets, that is also here. Loha. So Susuta is given everything. We don't know. That is the problem. So how to remove the foreign body? Yantra Shastra Shara Agni Pranidhana. Finally, wound is coming. So wound management. So this is the very good explanation what is Ayurveda surgery. But in society, my dear doctors, anybody asks, you are BMS, yes, have something? Surgery? What type of surgery you have done? Your surgeons? What kind of surgery? Kapanavada? They ask, So, what is our answer? This definition. Okay, I'm going. Okay, Trividha Karma. It is very essential. Purva Karma, Pradhana Karma, and Paschat Karma. This is not only Pancha Karma, surgery also, Western or Allopathy or Ayurveda, this is essential. This is Purva Karma. We should, I need to tell you, all photos are taken by me and I involve all photos, not internet photo. So, prepare the patient, Purva Karma. We need to make the surgical instrument, trolley. So, these are Purva Karma. And Sasuta tell 60, Shashti Upakrama. See this? Apatarpana, Virechana. Purva Karma. Chedana, Sivan until. So these are the Pradhana Karma. Others are supportive. And Yantra. Colonoscopy is a modern. Technology is there. Who can't tell we can't take that? Nobody can. I know you come by vehicles, no? Anybody tell, don't come vehicle, you are the doctors? So, anybody can't tell, this is the colonoscopy, this is you can't use? No, it is a nadi yantra. We can use. Proctoscope, you know all. So, this transrectal ultrasonography, these are very essential for today. Then I am asking, today surgery, today Ayurveda, we are doing for the nowadays people, not ancient people. BMS given, MD given, what for? For nowadays working. Otherwise, nothing, we need not education or nothing. Okay. Shastra Karma. This is essential. What is Ayurveda surgery? Again, we depend these 8 types of Ashtavija Shastra Karma. Without this, nothing. All are coming from here only. Chedana, Vedana, Lekanation, Aharana, Vistravana, Sivana, Ashtavija Shastra Karma. Chedana. I am going. Fist, excision, fistulectomy, cholecystectomy, hysterectomy. Madam, gynecological part we done, is okay. Hemant is done, I am assist. Then I got the photo. Normally we are doing cholecystectomy. Others are normally we are doing. It is called Chedana Karma. This is Vedana. Sorry for this photo. It is bad. These are abscess. I know my IM was here. This 2 weeks ago we met this patient. I will explain next. It is Vedana Karma. Lekana Karma, curettage, I think D and C familiar for the gynecologist, and Vedana Karma, Vedya, Shira Bahuvidya, Mutravruddhi, Dakodara. Definitions are there. Ashana Karma, all know about, most of people are practicing Chara Sutra. We use this probe, Ashana Karma. And Aharana, extraction of the nail bed, nail. Vistravana, or bloodletting, we know that. And Sivana Karma, suturing. And Shara Karma, wound and anorectal disease, we are using Shara Karma, RSS treatment. And Agni Karma, then Rakta Mokshana, all know about that. And wound management. So, this definition is done now. I think you can understand what is Ayurvedic surgery now. Okay. Now, our organizers asking, your presentation is surgery only, no Rasaushadhi? He's asking me, no Rasaushadhi? So, again I put something. Actually, I am frankly telling, honestly telling, what we are doing. So, surgical intervention, how we use our drugs, because we can't use antibiotic, we can't use analgesic, and my commissioner, Central Pharmacy is here. He know that we are how struggling to take anesthesia. Without anesthesia, we can't do anything. So if you tell you are using anesthesia, that is a problem. If you tell we are not using anesthesia, that is a problem. Criminal work, because without anesthesia, we are criminal work done. If you give anesthesia, Western allopathic people come, why you are using this? So, very difficult. Right. Actually, Rasaushadhi, Harapadmani madam is here. 2 years back, we invite her, please come to our forum and give your opinion for Ayurvedic surgery. Drugs. Actually, he gives some drugs also. Emergency drugs, in our hand, our OT, this is the main point for us. Without that, I don't know, we haven't any drug. Sometimes it is going to coma, madam. So we put some powders. I think Suvarnakalpa, the powders we are putting to tongue and take again his situation. And this is introduced by you, Harapadani madam. So we see, actually that part is bigger. In emergency we can't use that. We need to crush that. And Vahatva Chintamani, it is another drug we are using. Emergency 3 drugs we are using, but main part is Suvarnakalpa Makaradhi. Without that, we haven't any medicine. Every surgeon, anywhere, they are asking, emergency trolley is ready? Without we can't do nothing. And we are going to the modern allopathic operation theatre. If orthopedic surgeon asking, vascular surgeon is there? In Ayurveda surgery, nobody. Nobody with us. Our commissioner also not with us. Any problem? Nobody. Only me. Oh, whatever the person. Dr. Chandima is here, Dr. Dhammik is here. Okay? But I put some Rasaushadhi here. See? I think more drugs you described, nothing to describe with me, for me. So, no problem for me now. That is, thank you very much, last person here. And Chaturmukha and Vasanta Kusumakara. Madam, actually that is Kledha. They treat Kledha. So that is very useful for managing why Shalya Chikitsaka should be a good Kaya Chikitsaka. So then we use these things. Because patient is coming with wound or diabetic, so how we control? It is essential. And Panchamutta Parpati, this is very valuable. I think nobody talked this about. It is Grahana Chikitsa. Very important. Underline this drug, I will explain next time. And Agnitundi, Arogyavardhana and Ichcha Bedi. This is also used with normally GIT tract. And Abra Bhasma and Hiraka Bhasma, cancer, we can use that. And organizers need more Aushadha. So I put again. Rambani is Sri Lankan, Sitaram is Sri Lankan, they don't know. And Chandraprabha, you explain more, madam, so no detail about that. And I put again Shila Jatu, why? Because Sri Lankan haven't any Shila Jatu. So we are taken from India. If Sri Lankan Chandraprabha, I don't know they are taken or not. I don't know, but Shila Jatu is another one tablet form also we can available in India. And this is special. And we are practicing without any other, normally prepare the patient with what antacid, antibiotic, analgesic for the before the operation and after the operation. These 3 drugs we are using for that. Very important for us. Actually, we are thinking dosha, samabala, dosha, samya, dosha, imbalance, balance. We are thinking we are using 3 drugs for the operation before and after. And Lakshadi Guggulkalpa for orthopedic. And I put again some medicine because of organizers. But actually this is very valuable. Today morning I think, see these drugs. There are 3 types. What about opinion, madam? What is your thinking about? I put Kapha, Vata and Pitta. So then we can use like that, likewise. Because patient come to the surgery or whatever problem, we should manage with other problem. These days we are suffering fever. Very important for these things. Lakshmi Vilas, I think explained by madams also. Now I come to the different cases in my experience. Tell me frankly, without lab facilities, what to do? Patient come to OPD, we admit, no any laboratory report, operation, finish. But actually we have good lab in Pallekali hospital. That person who, very good person, he try to do our things. So actually the result, one day patient come with HIV. I thought without lab facility, everything khatam, finish. So we are fortunate at that time. After patient come, 30 years old patient, and diagnosed as an infected fissure. So admit, lab report is waiting. So it is emergency case actually. We take to the OT, and finally I am waiting the lab report. Lab report come HIV positive. The patient coming from Matale. So I call to the regional office and take his everything and call them and send to the Matale STD clinic. Never operate. So without lab facility, how do the surgery? Carefully think about in OPD, how do you care yourself? So then I am telling, we are treating to the present people. And elective surgery we are perform routing method, and emergency should be take. Like Atipathisya Rogeshu Sloka, you know about, no? Right. Come to the cases. This is Arsha, you all know. Treat. What do you think? Surgery? No. This is only basic treatment. You also can practice. My intern can practice. This is also basic. This is Chedana Karma. 3rd degree, 4th degree hemorrhoid should be treated by Chedana Karma or any other Shara Karma. Immediate result is come. And Shara Karma. And this is a paper published as multi-modality treatment. We try to Bhaishaja, we try Agni Karma, we try Shara Karma, Rakta Mokshana, but fail, and then Chedana Karma is done. So multi-modality. Think one thing, we should diagnose first. Everybody telling, oh, what is the OPD, drugs, AAA, whatever things. How do you treat? Diagnose is best. And your strategy is main thing. Then result come. Again repeat the medicine. But we are treating Kashaya and other Ayurvedic medicine. But these are also we can use. And I put this one also because no medicine from Duta Professor, I put this. Actually, this is can use 1st degree and 2nd degree hemorrhoids only. Other one should be go to the Shara Karma, 4th degree Chedana Karma. Infected fissure should be Shastra Karma, complete cure, and come to the Bagandhar. This patient is referred from another hospital, and this is a simple fistula, but some mistakes there. Again we recorrect, and patient is last week we discharge. And complex fistula. See this patient. Several times Shara Sutra done, but recurrence. Not recurrence, patient is suffering. See the MRI report, they guide. This is our surgical intervention because this patient 27 years old. I think my intern is here. And that vagina also, there is opening there. So in between vagina and anus, we are treating for new technical. It is minimal invasive technique. Actually, we respect to the Professor Manoranjan Sahu. He is the finder from this technique. So see the result. Because another opening also there. So we Vedana Karma was done. But main surgery is success. See the result. Those are vanish. I think patient today also on the bed. We discharge tomorrow. And after 1 week, we will remove the thread also. See the MRI misguided. This patient is coming with MRI. MRI is given idea about 6 o'clock opening, internal opening. So I also try 6 o'clock. Window open, going to find the internal opening, but I forgot, I couldn't that. But it is going to 12 o'clock opening. So MRI is not recommended correct tool for the fistula. Sri Lanka thinking about MRI is the best. I think Southside student, there's a research, a PhD scholar, MRI was trust. He found trust is the best. I think in Indian money, it is 3 crores. Sri Lankan never see the trust. So we are very poor people, but we treat this patient. And this is Charasutra therapy, misguided, perforated anus. And we postpone the operation. We can't do anything because anus is perforated. Very difficult. Danagiyot kataragama nodanagiyot ataramaga. Sure. So that is the problem. Another 2 examples for Bagandhara because very famous now. Patient is coming. You can see the external opening here, like 5 o'clock. We treated for this, but patient is complaining, bleeding and pus discharge. Not only the external opening, complete anus also. So what I do, I try to stop the bleeding and pus discharge, like a proctitis condition. But finally, I remove the thread also. I write down to the Kandy hospital, do the colonoscopy to find out the correct cause. I think those MOs in a hospital, they are blaming, why you come here? You can do there. But finally, again they write sigmoidoscopy. Because surgeon is there. Surgeon understand what I recommend, what I need. So he write down this one. So you can understand that is not Bagandhara. I am waiting for report. Careful for Charasutra method practicing person. External opening, internal opening, everything is not Bagandhara. Take care about that. So this is another example. Very important this. This patient, 3 years before I met in Nath Hospital, Borella. I operated this patient. 30 years at that time, I think 27 years old. Male, 6 o'clock abscess. So I drain, but it's a Bagandhara, I put one thread also. Finally, he not come in regular dressing. But I advise, come to proper dressing. But he never come. Then he went to the modern doctor also. Very simple one. See this, after 3 years, what happened for him? Ketone is there. This is ketone. He went to the modern allopathy doctor, surgeon. He treat like this. This is now condition. I remove this thread and some treatment done. No any surgical intervention. See this. Patient's condition with allopathy medicine. Beautiful boy. But today, suffering. See this medicine. Madam, do you think how much for this? one injection, 10 lakh rupees. Madam, there are 5 times he given the medicine. And the consultant advised, next one is final, and that is going to the coloscopy. So patient come to us. I haven't any answer, but I am trying. See the MRI, see the scan report. This is question mark Crohn. That is fistula. So see the Bagandhara's condition. Don't think simply. Bagandhar is our good weapon for Ayurveda surgery. Bagandhar is the best. Ashtavidha Mahagada, you know. Vata Vyadhi Smari Kushta Mehotar Bagandhara. We can do something for society. But think about, if as an Ayurveda physician, so Ayurveda person, if you miss these cases, it is bad effect for us. Anybody asks, what you can do for Ayurveda surgery? Because modern robotic surgery also there. But this is very important for us. This is cancer patient. 80 years old, he came to me. 2.5 years we support only. Nothing. But he bleeding less and comfortable little. He died after 2 years. Because no. So many people in our society, so many ads, so many Rupavahini and Tradio. Think about doctors, no? We know the range. What we can. This patient is coming to actually our most senior person referred to me. 2 months he is like this. How suffer? No doctor seen? At that time I give the treatment and gone. But again not come. I couldn't follow. And other thing. Ayurveda surgery is anorectal is Ayurveda surgery. This type of condition, what do you know? Arshas? Patient are telling, I am suffering arshas. Doctors are treating arshas. I am correct? What is this? This is hematoma, blood clot in the anus. So it should be removed. If you misguide, if this arshas, hemorrhoid, you are failed. Why? Because if you open this, bleeding, nobody can't stop. So diagnosis best. Right. Is this Bagandhara? This is different. Now I am going, time is okay, no? Yes. Okay. This is that Vidradi. Patient is coming. See the passing blood sugar? 455. My interns are here. If I am frankly telling, today how much? I think yesterday 155. But IND done and patient is okay now. No discharge also. And wound management. Time is okay, no? How much? 5 minutes? Okay, I will try. So, wound management is best for Ayurveda. People don't know, we haven't many medicine. I am going because they are posing to finish diabetic wound. I think one patient died in my hospital at that time, 3 days given for me. And urinary disease, good result. I think some cases madam tell, Ushnavata, Astrila and Ashmari is famous. When we are sitting down in OPD, so many patients come and we can manage those very well with report, because those are going to the basic chikitsa. And this is forgot us. All are thinking Ayurveda is only the anorectal. This is our part. Emergency case also. Asti Sandhi Rog. You know that plaster of Paris? This is site taken from Peradini Hospital. So, POA mean, madam? Plaster of Ayurveda. I think again, I remembering Harapaddani madam, we make Satadavatu Grita in second year. So we make this paste by Satadavatu Grita. So it is plaster of India. Hemans are telling plaster of India. We are telling now plaster of Ayurveda. And Bhagna, you know that the main part, actually the Western surgeons telling myth. People are going to the Ayurveda, it is myth. But problem is, reduction is not good. People have good medicine. They don't know how to reduct. That is the problem. Okay. Dislocations. And neurosurgery. What about that? Neurosurgery we can do. See this? See the lumbar 4 and 5? I think most senior doctors do something. So we are doing neurosurgery. We can image that. And Urdi, hernia and hydrocele. Actually we never done in here hernia, but we done Mutravurdi. One case we done in Borella. Other my Dr. Pechala and Dr. Manori also supported. I am going no talk, see the pictures. See the testis, finish the work. And this is another case. Actually, I never put the pictures. Patient come, 30 years old lady from abroad. She need to treat Ayurveda. Borel is the main name. Patient come and we met, Dr. Pechala's patient. But one person, one lady doctor scan and it is not metastasis and it is localized only, that image there. But we take and to the operation and do something, we image that we can't do that. So we send again to the radiologist, it is metastasis. So we send to the patient. Actually the people telling, what is Ayurveda, Deshi Chikitsa, Ayurveda has good medicine for cancer. Should we think 2 times? Granthi Arbuda, only 2 minutes. I think this is Hemant and me in Indian picture. We remove this. I think Pallekele also sir told this. Before the marriage, we remove these things. Vidradi, I saw you. Slipada, Udararoga. Medaroga I remove because he not accept those pictures to put there. So I remove these things. And this is paste applied for Kadara, but finally remove the whole things. Acute wounds. And Chippa Kunaka Shuddharoga, you should remove that nail. See this case. Indian madams, this is only India book only, Das, Madura put. But I met in Pallekele hospital one put, army soldier, he is suffering this Madura put. And this is a good disease for treat. It is called Jeep disease, PNS, final nodal sinus, Nadivrana, successful managed by Ayurveda only. Actually, Ayurveda surgery only. Recurrence cases, many more coming to us. This is gynecological madams are here, no? Skin gland. Madam, any surgery for skin gland for you? From you? Any experience? No? Yes. Fortunately, we met one lady from Sri Lanka. Sausa also, one patient only treat his life. Sausa is now 77 years. But we fortunately met this case. But we haven't image about what is this. But finally we asked to our teachers also. And the marsupialization is the treatment for this. Correct? Finally we put that catheter because of the protection of the urethra. Finally she is okay. Kapaja Granthi. I think Priyani madam know about this. It is Actually, madam sent me this patient. She's okay. Think about this. Without Commissioner Central Promise, Vikramatilaka sir, medicine, nursing staff, patient and physician should have. Actually, he is very supportive person for me. Without this Chatuspada, we can't do nothing. Without support of management, actually he should be educated people. Otherwise we can't do. The fortunate, unfortunate, I don't know. Without these things we can't do. We are happy. I am very happy. This is Professor Suvarnakalpa. He is a Dean, Faculty of Medicine, Peradeniya. Fortunately, he is an anesthesia professor. So he is supporting me. There is a talk here. If I tell I am using anesthesia, problem. Without anesthesia, another problem. So he is supporting me, then I am okay for surgery. See this child from Hambantota. Without anesthesia, how we do? This is done by privately because we haven't anesthesia machine. We are waiting for that. Thank you very much.
Thank you, Dr. Anura Vikramanayaka. It was very informative in an arena where we don't speak much and was not heard here in Sri Lanka that much. Thank you once again, and we would like to felicitate you. I would like to invite our co-chair, Professor Dr. S.P. Molligoda, to hand over a token of appreciation to Dr. Vikramanayaka. Dear doctors, dear colleagues, my friends, students and all, as we are running short of time, we are skipping the open session, but the questions and answers will be provided to you. You'll be able to talk with the speakers today after this program. After the Rasashastra Sambhasha, you can present your questions to the speakers right after that. So we are moving on to the next address. I invite our chair of Rasashastra Sambhasha 8th edition, Professor R.S. Jayawardena, to address the gathering.
අමාරුයිනේ තේකුත් බොණ්ඩ හිතෙනවානේ ඕගොල්ලන්ට වැඩි මට අමාරුයි මත් නිසාදයත් ඕගොල්ලන්ට ටොයිලට් එක ළඟයි මට එහෙමත් නැහැ කෙසේ වෙතත් හොඳ සෙෂන් එකක් ඇයි මේක කව කරා කෞමාර වෘත්‍ය කියන ෆීල්ඩ් එක රසශාස්ත්‍ර ෆීල්ඩ් එකත් කවර් වුණා I will come to your point later on and surgery පැත්තත් කවර් වුණා gynecology obstetrics and බාල රෝග pediatrics. Gynecology obstetrics දෙක මට ටිකක් සම්බන්ධකමක් තියෙනවා. Why? Because my wife is a gynecologist in the field of Ayurveda. So, බය වෙන්න එපා ශ්‍රී දූත පපේශ්වර් මේකට පස්සේ තේ එකක් සූදානම් කරලා තියෙනවා. ඊට ඉස්සරලා අපි අකමැතිම සෙෂන් එකක ලාස්ට් එක ස්තුති කතාව. ඒකත් හරි ඉන්ට්‍රස්ට්. The vote of thanks will be given by my friends, Dr. Ketan and Mr. Ranjit Puranik, the diamond of Ayurveda, especially in the Rasashastra, Dr. Mukesh B. Chowda, Professor Dr. Sujata Kadam, Dr. Aptikar, and Dr. Ketan. You all are from Bharat Desh. So I have heard when I was in India, Atiti Devo Bhava. Ranjit Puranik ji, I believe that Atiti Devo Bhava. And आप सभी लोगों का मेरा प्यार भर नमस्कार है. Namaskar. And my co-chairs, Professor Malligoda, which we are in the same department, Dr. Karunaratna from Gampaha Vikramaraj, and she was left, I think, Professor Priyani Paranagama, our former director, and respected dignitaries, Dr. Tennakon, yes, he's here, and Dr. Gamage Jayavardhan, I saw him, he is most senior to me, and most senior to me, Dr. Dayangani, and from Gampaha, there is one of the lady professor there, Dr. Priyani, and esteemed scholars, dear colleague, and students. First of all, I would like to thank the organization committee to appoint me as a chair in this session. There is one, I have forgotten something. මට කාර් එකට යන්න බැරි වෙනවා දැන් මේකට ගිහිල්ලා. අඳුනා ගොඩක් ඒවි. මං ගැන කිව්වේ නෑ මගෙන් අවසරය ගත්තේ නෑ කියලා. කොහේ හරි ඇති මම දැක්කේ නෑ. She is my wife. අවසරයි Can you understand what I say? You have good experience on that. When husbands forget mention the name their wife, that is the problem. So that's why I remember my wife. And there is another things, Lokapurushamya, our students are there, and Dr. Saumya, he is a lecturer who used to lecture on this special topic, Lokapurushamya. there is a one word, it is called Yatha Loke Tata Pinde. So I would like to change little bit this. Yatha Bharate Tata Sri Lanka. Am I correct in Sanskrit? Sri Lanka, isn't it? Yata Bharate Tata Sri Lanka. That is good, no? Whatever in India, everything you can find in Sri Lanka. Buddhism, culture, arts, music, Ayurved, Rasaushadhi, even sari, who are wearing all the saris. Everything. So that's why this is my personal belief. When I was in 1990, to do my MD in Basic Principles and Siddhanta, I feel that I don't like to say India. I like to say I lovely. I like to say Bharat. Sri Lanka is my mother country, Matrubhumi. India is, Bharat is my Pitrubhumi. And it is both an honor and privilege to chair this valuable, informative, illuminative session that showcased the vast clinical potentiality of Rasashastra across a diverse spectrum of Ayurvedic specialties. Today, our session, this valuable session, began with Professor Dr. Kadam. The pronunciation is okay, no? Yeah. She detailed the application of Rasaushadhis in Prasuti Tantra. I think my wife gained many things from that presentations, USB, that highlighting how judiciously prepared metallic and mineral formulations, when used with classical understanding, I am a basic principle man. I found in your presentations, there is a basic science behind there. So I was so happy. Can offer powerful solution in managing pregnancy. I have that experience with me, with my wife. I have seen how my wife is treating. So thank you very much. That is very interesting thing. My student grabs many things from that your address. Then we had a chance to hear the learned physicians, especially in Rasashastra, Dr. Mukesh Chawda. He offered valuable observations on supporting male reproductive health through Rasaushadhis. This was very much interesting. Drawing from both ancient references and clinical research and his own clinical experience, he presented the rationale for their use in disorders of Shukra-dhatu and overall vitality. I am very much interested in that Shukra-dhatu and vitality. That's why I maintain my health. So there is something going on in my personal life, marriage life. Sometimes my wife, she used to एक गाना है वो sometimes ही गाती थी मैं क्या करता हूँ मैं बुढ़ा हो गया होय बुढ़ा हो गया मैं क्या करूँ राम हो मैं बुढ़ा हो गया मिल गया ඔය සින්දුව කියනවා මට දැනන මොනවා හරි මගේ reproductive health එකට අවුලක් වෙලා ඇති කියලා. Something happened to my reproductive system because I am very old man. Then I used to take Rasaushadhi with Chavanaprasha and Rasayana and everything. Have you got the music? After getting sometimes, nearly 2 days, 4 days, 5 days, she used to listen to this song and he used to හොඳයිනේ. Reason? What is the reason? Rasaushadhi. So, Dr. Chowda, what you said in your presentations, totally correct. Totally correct. Here my students and my colleagues are there. Try to use this. You may become a very young man. සාමාන්‍යයෙන් වාත දෝෂය හවස් වෙනකොට වැඩි වෙනවා. මහලු වෙනකොට වාත දෝෂය වැඩි වෙනවා. දැන් අපි සියලු දෙනාගේම වාත දෝෂය වැඩි වෙලා ඉන්නේ. ලෝක ධර්මතාවයක් තියෙනවා. උපදිනකොට මේ පෘථිවිය චුම්බකත්වයෙන් අපිව ආරක්ෂා කරගෙන ඉන්නවා. බදාගෙන ඉන්නවා. අපි ටිකෙන් ටික ග්‍රෝ වෙනකොට තරුණ බවට පත් වෙනකොට අපි ගුරුත්වාකර්ෂණයෙන් පොඩ්ඩක් ඉහළට යනවා. ඒ තාරුණ්‍ය පිත්ත ප්‍රබල කාලේ. ටික කාලයක් යනකොට ආයේ මේ චුම්බකත්වය අපිව එල්ලලා වටනවා. මෙහෙ එල්ලෙනවා, මේවා එල්ලෙනවා. අවසානයේදී අපි බිමටම කොන්ද පාත් කරගෙන යනවා. සංස ව්‍යාස වෙද සාප සාද රුක්තෝද බේදන සංගාංග බංග සංකෝච වර්ත හර්ෂණ තර්ෂණ කම්ප පාරුෂ්‍ය සෞසීරිය ශෝෂ ස්පන්දන වේෂ්ඨන ස්තම්භ කසාය රසතා වර්ණශ්‍යා උරුණෝපිව මේ සියල්ලම අපිට වෙනවනේ නේද? හැබැයි මේක postpone කරන්න පුළුවන්. We can postpone this kind of signs and symptoms by using the Rasaushadhi. We heard from many speakers that Rasaushadhi has great vitality. Thank you very much, Dr. Chowda. Next, Dr. Saroja Virokon. She followed with the insights on use of Rasaushadhi in Balaroga, where she underscored their role in strengthening the Agni and improving the immunity of the children and addressing chronic pediatric conditions with gentleness and safety and efficacy. I had a chance to participate in a seminar which held in India. At that time, there was in Sri Duta Professor Limited, they are organizing Swarna Prasha. So I bought some Swarna Prasha with me also, and I gave it to my kids. They are very intelligent. They are very beautiful. I have that experience also, Swarna Prasha. We will try our level best to introduce Swarna Prasha in Sri Lanka in near future. Thank you very much, Dr. Saroja. She is one of my students also there. Next, we had a chance to listen to Dr. Aptikar. Am I correct the name? Yeah. She added depth with his talk on Rasa medicine in gynecology, giving us a practical lens on their effectiveness in conditions like menorrhagia, PCOS, infertility, and the menopausal syndrome. Only the thing is, Dr. Aptikar and Ranjit Puranik ji, we don't have not unavailability of these drugs in Sri Lanka. So we are facing this problem. Actually, I am very much sad that when you are saying these kinds of medicines are there, but we don't have. Even we prepare these drugs. Personally, I don't satisfied with. We don't have standard operative practices to prepare the Rasaushadhi here. We don't have Anupana, even. Very limited Anupana there. So how we can practice? So Ayurveda administrative personnel are there. Please, try to import this medicine. Oh, try to import the raw materials and try to establish the manufacturing practice here, factory here, to follow the operative procedures, GMP. Ranjit Puranik ji, I invite you to establish the factory here. Then we can easily make availability of the Rasaushadhi, not only the Rasaushadhi, but also many. And patient get easily with low price. This is what we need. So administrative officers, if they are, listen to me, I think that he is there. And try to do this. There are many problems. Importing the drugs, manufacturing drugs. There are lack of administrative methodologies. And Dr. Aptikar, thank you very much for your valuable address in this You illuminated these sessions. Good. I need your presentations personally. I want to go through it and grasp many things from them. And next, he is one of my students. I am very much happy that you are one of the speakers here. Before coming here, I didn't came to know that the Anura, no? Yes. Anura is one of the surgeons in the field of Ayurved. So as a teacher, I am very much happy. And Anura, through his presentation on Rasaushadhi in Shalitantra, took us into the surgical and parasurgical space, where Rasashastra formulations such as Bolabadda and many other how can support wound healing and infection control. So, Dr. Ketan, I'm taking much time? No. Because I don't have break, huh? Yes. Together, these presentations reinforce one clear message. What? Rasaushadhis, when prepared and administered in line with classical principles, offer an unmatched breadth of therapeutic utility, from pediatric to surgery, from reproductive health to chronic disease. This is my conclusion. Let me speak some more. From the Sri Lankan context, the importance of Rasaushadhis is well acknowledged. Yet, there remains untapped potentials. That is the problem here, untapped potentials. Let me offer three perspectives. One, firstly, as an academic leader, I was in 2006, being a former director of Institute of Indigenous Medicine, I observed that many Ayurvedic students and interns are intrigued by Rasaushadhis, but often lack clinical exposure and confidence also. Session like this ignite that confidence and encourage responsible use under guidance. So that's why I started. This is the illuminative session. From the lens of the secondly, I would like to express. From the lens of a manufacturer, I was sometime a managing director there of Sri Lanka Ayurvedic Drug Corporations. There is growing interest in building capacities to prepare rasa medicines, adhering to Shodhana and Marana protocols. However, the need for robust SOPs, it is needed, SOP is needed. Standard operative practices based on Ayurvedic principles remain present. Finally, as a senior practitioner, trained in both Sri Lanka and Bharat, in BHU, I recognize the need for continued dialogue, training, and exposure to successful case studies and quality benchmark. There is a growing curiosity and a genuine desire to responsibly integrate Rasaushadhis into routine practice in my hospital. Most of the, I think 100%, my prescriptions, more than 75% of the prescriptions are Rasaushadhi. All the Rasaushadhi I am getting from Sri Dut Papeshwar Limited. Shake. Having visited, I think I visited many times in Sri Dut Papeshwar Limited manufacturing facilities, I must commend their inspiring balance of traditions and scale. They have industrialized ancient Ayurvedic procedures without compromising on core principles, ensuring ancient wisdom with modern technology. They have put the ancient wisdom in a nice, what is called, wine bottle. Ayurveda principle based on SOP is rooted in classical text. I would like to proceed without compromising core principles that ensuring Ayurveda principles based on SOP is rooted in classical text, standardizations of raw materials, processings and products across batches, ensuring an approach that respects the Ayurveda rationality, combinations and sanskara in each formulation. Simultaneously, a willingness to embrace modern research tool. Today we heard some, but they have taken the modern research tools and quality technologies to complement Ayurveda parameters for analyzing, process validation, confirmation to meet global quality assurance. මේකා තාමත් ඇදගෙන යනවානේ. තේක ලෑස්ති කරනවා කියලා කිව්වා. Sri Guti-Vati Limited, beyond manufacturing them, has played a pivotal role in strengthening the Ayurvedic knowledge ecosystem through initiative like Jyotismati. We don't have this time Jyotismati. I didn't find any Jyotismati news here. You are going to organize this good. Students, get ready to Jyotismati education quiz series. There is one doctor here. Yes. He was the winner, I think, 2 times in Jyotismati. Yeah. The educations, it is for students only. Next, the Rasashastra Sambhasha, each and every year. This time, 8. Puranikji, 8 is the auspicious for Ayurveda. You know why? In Charaka Samhita, 8 sthanas are there. Why? Because 8, we consider 8 is the auspicious number. And each and every chapter begin with the name. Atatho dirgha jivita madhyayak vyakyasayamaha. There is 8 words there. So this time, I am very much happy that when I was sitting there, I saw that 8. So this Sambhasha 8, I am a chair. So I am very much happy. So that is illuminative session, this. In conclusion, now I am going to wind up my, as a chair, I extend my heartfelt gratitude to all our speakers from India and Sri Lanka, and to Sri Guti-Vati Limited, not only the producing the medicine here, but for nurturing confidence in the practice of Rasashastra. That confidence, actually I bought from Sri Guti-Vati. May this journey of dialogue and discovery continue to empower Ayurveda physicians across the world. And there is in this session, behind a team, Chintaka, Anasli, Vasu, and other team. I love them. They have organized this session well. And they prepared the refreshment also. And after that, I think there is a fellowship and dinner. wherever the rasa, there is Sri Duta Papeshwar. Wherever there is Sri Duta Papeshwar, there is rasa. So there is a rasa bojun in somewhere after this session. Shad rasa, you can experience the shad rush there. And you can refresh your head. Menna rasa, meyai rasa, sirasa kela ogullanta satut wenna puluwan. So bahut bahut dhanyawad. And bhumi stuti Puranik ji, मेरा हद से आपको प्यार करता हूँ. Thank you very much. Thank you very much, dignitaries and all. And a student, I think, so that you have grasped many things from this session. Thank you. This is my short length address. Let me have lengthy address here before have a refreshment. Bhumi stuti. Bahut bahut dhanyawad. Thank you very much.
Thank you, Professor. It has been an honor for this session to be chaired by you this time at the 8th edition of the Rasashastra Sambhasha. And I would like to invite Dr. Ketan Babkar, Manager Exports of Sri Guti-Vati Limited, for the vote of thanks and felicitation.
Good evening to all present here and attending this event online through webcast. As we come to the close of this meaningful gathering, I am deeply honored to present a vote of thanks on behalf of Sri Guti-Vati Limited. Our sincere appreciation first goes to Professor Jayawardene for gracing the occasion with your inspiring and energetic words as a chair and your continuous encouragement to Sri Guti-Vati and all the students and the fellow practitioners of Sri Lanka. We also thank Professor Molligoda and Dr. Minrupa Karunaratne for gracing the occasion as a co-chair. I would now would like to request Mr. Ranjit Puranik, Chairman and Managing Director of Sri Guti-Vati, to present a token of thanks on behalf of Sri Guti-Vati to Honorable Chair Professor Jayawardene. We are also presenting Sri Sinhalese version of Kalpa Mimamsa. This is always an endeavor of Sri Guti-Vati that to produce and to bring authentic Ayurved knowledge in detail. These are first copies of Sinhalese Kalpa Mimamsa. I would also request Professor Molligoda to please come in front to accept our token of appreciation. Thank you, Madam, for co-chairing the session. Also, Dr. Minrupa Karunaratne from Faculty of Indigenous Medicine, Gampaha Vikramarachi Institute of Indigenous Medicine. Thank you, Madam, for accepting our invitation and gracing the occasion as a co-chair. I would also request Mr. Ranjit Puranik, sir, to kindly felicitate our knowledge partners, Faculty of Indigenous Medicine, University of Colombo. I think the Dean is not present. May I request Professor Sajiva Harpadenia to kindly accept our token of appreciation. Thank you for your support all these years. We are also thankful for Faculty of Indigenous Medicine, Gampaha Vikramarachi University of Indigenous Medicine, Dean Professor Priyani Pires. Thank you, Madam, for all your valuable support. I would now would like to invite Dr. Vasanta Pushpakumara, Technical Commissioner, Department of Ayurveda, to kindly accept our token of appreciation for being present here. I think he left. I would now request Dr. Cyril Vikramatilaka, Provincial Commissioner, Central Province, to kindly come forward and accept our gratitude. Dr. Priyangani Godage, Provincial Commissioner, North Central Province. Thank you, Madam, for gracing this forum by your presence. Dr. Manjula Manatunga, CMO Director, Southern Province. Thank you, Madam. Dr. Ayesha Munasinghe, CMO Director, Western Province. Thank you, Madam, for coming all the way here and attending this session. Dr. SMS Samarkund, Director, Postgraduate Institute of Indigenous Medicine. Thank you, sir. Dr. H.D. Tenakun, former Director, Borella Teaching Ayurveda Hospital. Thank you very much, sir. And I think the senior most, Dr. Dayangani Senasekara, former Technical Commissioner, Department of Ayurveda. Thank you, Madam, for blessing us with your presence at this forum. Thank you, sir. That concludes the felicitation. Bhavasthirani Jananantara Saurudani. This verse by Kalidasa, which aptly resonate the today's spirit of this occasion. This word reminds us some connections go beyond time, beyond contracts, and beyond formalities. These are rooted in trust, mutual shared values, and shared commitments, mutual respect. Our connection, our association is one such bond. We are truly grateful to all dignitaries, all partners, supporters, my team member, extended team members who have walked through this journey with us, not just for this one event or this one initiative, but over the years of collaboration and mutual growth. As this forum moved from 2015 to 2025, as this forum moved from Lavender Hall of 150 capacity to this Grand Lotus Hall of 550 capacity, as this forum were graced by more than 51 speakers, researchers, scholars, practitioners from India and from Sri Lanka, which made us possible to bring to this status. Your presence, your contribution, your commitment, and your support is invaluable for us. We are deeply grateful to all our distinguished speakers and chairs and co-chairs today. Thank you for embodying the true spirit of Guru and sharing selflessly your invaluable knowledge, experience, and expertise in limited period of time. We have to give this as a capsule in limited period of time. Sorry for that. I know you have much more to share with the audience. And being a guru, being a teacher, you would like to teach, you would like to give the insights and the expertise in much more length. But due to the constraint of time, though you have delivered much more, which will guide us, which will guide the audience in their future endeavor. And as we are talking of guru, the teachers, there are many teacher and guru here present. I would like to proudly put on record on this forum that Professor Kadam is actually a teacher of mine from Pune. And Madam, listening to your presentation and seeing those slides took me back 20 years almost, as if I am sitting in the third year classroom and listening to your lectures. I remembered a poem I written on our farewell, which will aptly fit to this occasion. Though it is in Marathi, I will translate in English in a gist. त्या मार्गाचे मार्गस्थ आम्ही जो मार्ग आपण सुचविला, संकटे मग लाख येवोत अचानक वादळे, संकटांना चिरडू न टाकू, वादळांना मग हे कळे, आशीर्वाद आम्हा कोणी दिला, त्या मार्गाचे मार्गस्थ आम्ही जो मार्ग आपण सुचविला. This is for you and all the teachers who are present here. Thank you for empowering us and empowering the audience with such an in-depth knowledge and message. I am sure this knowledge and this experience shared by these speakers and chairs and co-chairs will help you all in your day-to-day practice to conquer and overcome the challenging health conditions as they present in your day-to-day practice. Thank you once again for all this knowledge sharing and empowering us. After all, audience, supporters from across Sri Lanka, from Jaffna to deep down South America, doctors, faculty members, students, interns, those will be future doctors who are practicing. Thank you. You are the energy for this forum, and your association and this energetic participation keep this forum thriving. Thank you for the participation. Last but not the least, I would like to thank my organizing team, Chintaka and Team SDL Sri Lanka, Hariharan and Team Solimix Sri Lanka, AVH distributor, Mr. Vasudevan, Mr. Annesley and his complete team, my team back in Mumbai head office, our extended team. I will not call you any vendor or supporter. You are our extended team, Mr. Lakpriya, Mr. Sena Naika, BMICH. This is the 8th continuous edition we are conducting in BMICH. Mount Levenia for serving the delicious refreshment after the session. Also, Dr. Natalia Veera Vardana for your excellent anchoring. Thank you very much. Your tireless behind the scene and attention to the details had made this event truly successful. Thank you very much. And as we look ahead, let us carry forward the strength of this occasion, pride and unity, so that the Rasashastra and complete Ayurveda is practiced confidently, convincingly. Thank you very much. I would invite all the speakers, dignitaries to come forward to take a group photograph together. And audience, thank you very much. The refreshment is ready. You can enjoy the refreshment, and we will definitely see you across the year taking this dialogue forward in our day-to-day visits, and also see you again next year to Rasashastra Sambhasha 9th edition. Thank you.
This one. Once again, we thank you on behalf of Sri Guti-Vati Limited for joining the Rasashastra Sambhasha 2025, inviting the speakers and the intellectuals to join the group photograph, and for you to enjoy the refreshments. Thank you and have a pleasant day.